Okay, so without delaying, just we will start off with the session. A warm welcome to all the judges and the participants. So let me introduce myself first to you. That this is Manisha. I'm the Vice Principal of Radiant Institute of Nursing and Paramedical Sciences, that is in Kishanganj, Bihar. And so I would like to introduce you people to the organizing chairperson. She is Dr. Sarika Saxena, ma'am. She is the Vice Principal of College of Nursing, Government Institute of Medical Sciences, Greater Noida. A warm welcome to you, ma'am, to this session of the paper and poster presentation, ma'am. And I would like to introduce all the judges, the jury panels for these presentations. So Dr. J. Satya Shenbega Priya, ma'am, she is a principal in College of Nursing, Kannur Medical College, Kannur, Kerala. Professor Mrs. Purnavini Keshwan, ma'am, principal. She's from Santosh Institute of Nursing and Research, Bangalore, Karnataka. And Dr. Priyanka A. Masi, she is a principal of Rohilkhand College of Nursing, Bareilly, Uttar Pradesh. Professor Shilpa J. Ma'am, she is a vice principal, School of Nursing, Arka Jain University, Jharkhand. And Dr. Purohit Saraswati Ma'am, she is an assistant professor of JSS College of Nursing, Mysuru. And Dr. Meena Roopkumar Pagarwar Ma'am, she is an assistant professor, College of Nursing, Government Medical College, Nagpur. Mrs. Steffi Abraham Ma'am, assistant professor, Parul Institution of Nursing, Parul University, Gujarat. And Dr. Gargi Karadkar ma'am, she is an associate professor of Bharati Vidyapeeth deemed to be University College of Nursing, Navi Mumbai. A warm welcome to all of you. And I would like to ask Dr. Sarika Saxena ma'am to just have some speech or just tell something about her and to motivate all the participants for this session, ma'am. It's over to you, ma'am.
Okay, thank you, Purnima. A very good morning, to everyone member, participant, jury panel members, and member that we have taken in the form of this international conference on education and research. And really, I would like to say about the Global Interdisciplinary Advanced Research Academic Foundation. This is a very commendable platform. I know that it is not started very, we can say that it is a recent new one. But I think as I have seen in the group, I have heard about it, the each and every member authority of this organization is a platform for the nurses, those who are in the education and taking involvement in the research also. So I would say that about the GIA-RAF, it is a really that academic foundation with a highly regarded India-based non-profit organization. We can say it is a highly, we can say it is a very recent one established in the year of the 2023. And many activities is done by this GIARF, and really this one is helping giving a platform to the nurses and the faculties and the students also. They get the upgraded knowledge to the research preparation, to the participation and also. So I would like to greet the people, those who are taking participation in this research presentation, and I would like to congratulate to the jury panel for the presentation, for taking the for giving the judgment. Right, participating today. So from my side, I would like to again throughout the period of time on today also and tomorrow and day after, everyone should take a zeal and interest for this international conference. Would like to wish you each and everyone. Thank you so much. Thank you from my side. Thank you.
Okay. Thanks a lot, Sarika Saxena ma'am, for this lovely speech and motivating all the participants. for just
Thank you.
presenting their paper and poster in this international conference. So without delaying, just I would like to continue with the poster and the paper presentation. I would like to request Dr. Rajni ma'am to start up with the session. Ma'am, you can continue with your poster presentation or the paper presentation, ma'am. Dr. Rajni ma'am, I think she is not available. So I would like to request Midhu Korean sir to continue with this paper presentation, sir. It's over to you.
Thank you, ma'am. Welcome to all the delegates, and thank you for the support. And just I am presenting my paper in front of you. Is it visible?
Yes, sir.
Okay. My name is Midhu Kurian. Just I am a PhD scholar for Usha Martin University. Currently, I am working as a principal, Uttaranchal College of Nursing, Uttaranchal University, Uttarakhand. My the conference presentations, just the title SOP is Structured Maternal Engagement as a Smart Preventive Strategy Against Acute Respiratory Infection in Under 5 Children, especially in the community-based experience study. Just before starting this presentations, just I want to explain more slowly. The acute respiratory infections are the most causes of the child death, and also it will be in especially in Uttarakhand area. We are working in the hospital side. I have seen a lot of mothers, those doesn't have proper knowledge, and especially in primary gravid mothers, they having problems with how to handle the children's, those who having the acute respiratory tract infections, and how they can manage the acute respiratory infection, acute respiratory infections. And that infection, there will be chances for the jaundice and other conditions or different pneumonia, and it can changes to other complicated conditions. That's why I have selected the topic. And in these presentations, I will explain background of problem statement and my study objectives, methodology and design. I will explain intervention, key results and findings, and last one, I will explain the conclusions. And before starting this one, just I want to explain the background. The main cause of unfair mortality is in India, acute respiratory infection, especially in children. Those who are under 5 children, there will be chances for high acute respiratory infection because of the mother having less knowledge, primary gravid mothers, those who are having less knowledge, and more than 800K children's death in annually from acute respiratory infections. And also the mothers, those who have in community area, especially in hilly area, just like in our state, Uttarakhand, they have a lot of hilly areas. They don't know how to handle the conditions, and there is no proper hospitalization. And that's why there'll be these conditions the death can occur in low middle income nations, just like India, especially in the different states, just like Uttarakhand, Jharkhand. These states can happen because there'll be a lot of hilly areas. And the maternal caregiving practices are frontline determinants of ARI prevention, especially in community setups. And if they have inadequate caregiver knowledge, especially in sometimes the primary gravid mothers are giving priority to their the grandmothers, mothers. And if they don't have proper knowledge, primary gravid mothers have not proper knowledge, or mothers having the proper knowledge, can make a gap for the care of the children. And there'll be suboptimal home care behaviors directly linked to delayed care seeking and poor outcome incomes. And there'll be targeted health interventions can happen for managing these conditions. Moving to next slide. My problem statement, just what are the research gap in this problem statement? There'll be knowledge deficit of acute respiratory infections for mothers, especially there'll be warning signs and evidence-based home-based management strategies. Because the mothers are lacking the knowledge, that's why there'll be maternal knowledge and suboptimal home care behaviors remain persistent gap for this study. And there'll be need a structured community-based intervention, especially we need to do proper intervention, health teaching status, or we want to do proper maternal engagement strategies. Before starting this topic, just I want to explain about the maternal engagement strategies, especially during the time of my data collections. Just I have feel special different. I have applied for different strategies, just like structured health educations and also skill-based demonstration. I have just like we have teached in different mothers for how to handle the baby during the time of ARI, and especially hand washing. We teach the hand washing techniques, and also we have teached how to breastfeed the baby during the time of these conditions. And we given the culture, we were given the community to the health education, especially because those who having there in the parents and also mothers. Only the mother, if we are giving the health education to the mother, it will not happen in a proper way. And we have also given the health education to the parents and also grandparents. We have also got health education. We went to the community area, and also we went to the primary health centers. And we have also used the visual aids, and we also connected with WhatsApp groups, and we give the proper health education to them. And my study objectives are increase awareness of ARI, especially and controlling the risk factors, and improve recognition of early danger signs, and build a knowledge of evidence-based preventive strategies. And also through that maternal practices, I have done correct hand washing and the hygiene behaviors, promote exclusive breastfeeding. Through this exclusive breastfeeding, also we can control the acute respiratory infections, improve immunization and adherence care. And also most of the hilly areas, they don't have the immunization health education, and some mothers will come to the hospital side and they will tell lies, we have already given the immunization. Because of the lack of immunization, also the acute respiratory infections can happen. Also they have reduced the reduction of immunity. And my methodology, my study design is, the first step is there will be purposive recruitment for the mothers, especially in the community primary healthcare units and also community area. And then step 2 is random assignment, experimental control we have assigned, and we have done the pre-test, and then we done the validate the acute respiratory knowledge, and we will do with the help of tools just like checklist and rating scale we have done, and we have intervention with maternal engagement strategies, and we have posters. It is audible, ma'am?
Yes.
And the interventions framework is there'll be structure sections, improve mothers underlying ARI preventions, and home-based management is using simple and clear language we have used, especially in Hindi we have explained. And the caregiving skill demonstrations we have done, especially in the to correct the hygiene practices, feeding practices, and also we will help them to identify the early symptoms detection, especially in the mothers. They don't know about the early symptoms, how to handle the early symptoms. We teach them, and we approach them in a positive manner. If we are teaching in English or jargons, if we are using, they cannot understand, because most probably they are working in the hilly areas on the community base. And we teach them in a proper manner. We communicate them with the Hindi and the normal languages. And also we teach them appropriate home care techniques, just and how to, before caring the children, how to hand wash and how to breastfeed, how to make a proper nutrition meal for the ARI children. And also we are culturally adopted pictorial tools, just like the diverse literacy levels. Those who are having the low literacy level status, we have teach in a proper manner. And also special images we have added. And we have also used the mobiles for, we made WhatsApp groups, and we have supported them on what are the problems they are affecting those ARI mothers they are affecting. And we reinforce them, and we follow up them how to handle the conditions. And the measurement and data collections we have done, we most probably we variable are assessed, and ARI preventable knowledge and home-based practice behaviors. And then instrument type, the validated questionnaire we have used, and checklist also we have used. And after the interventions of the early experimental study, experimental group, we have done the interventions, and then we have applied both the pre-test and post to the experimental control group. And after that, we have got these scores, and we compared them. There'll be especially in ARI and preventive knowledge having the high scores, and home-based practice also. You can see the graphs for the histogram for the charts. The participant feedback and acceptability is especially in the practical sessions. For the easy to apply in everyday caregiving situations. Sometimes if we are giving the research activities, we teach them, or we doing some researches, but it is not practical, and it want to be easy to apply for the community, and it will be easy for every day. That is the main important things for the every research or every innovations. That's why it can be easily applied for the everyday and for the caregiving situations. And step-by-step guidance also we have given, and we have also done follow-up also. If after completing the data collections, we will not do the follow-up, and we have done the follow-up also, and we have supported them in the community basis, because in every day we need to go back to the community, especially in our students are working in the community areas. That time we also supporting them, and at that time that mothers will come to our side. At that time they will tell to us why you are not supported. That's why we have made it the WhatsApp group, and we have supported for the guidance, and we've done the follow. And also in for this one, there is no need for the any money, and also we have especially there is no need for the equipment. The contextual relevant is that cultural appropriate materials and language we have used, and aligned with local beliefs and caregiving norms, especially sometimes those who are not using the special meals, just like some people are not using the meats, and that's why we are supported in the vegetarian manner. We have teach them in the vegetarian manner, and we are also used the pictorial tools accessible for all the literacy level. They can easily understand the pictures, and that before to understand. And how to adaptable seamlessly, it can be adaptable, integrated naturally into the daily routines. They can adapt for the mothers, and mobile reinforcement supported ongoing, where they will be supported with the WhatsApp group, and we have now also we are supporting them, and we have transferred the skill to others for caregiving behaviors. And I have concluding my topic, especially the structure, method, engagement, and operation of smart community health interventions effectively strengthens preventive knowledge and home-based care practices for ARI and acute respiratory infections among primary caregivers of young children, especially mothers. And the scalable strategies embedding such programs within preventive healthcare frameworks provide a scalable, impactful strategy for reducing under 5 ARI morbidity and mortality, especially in the community area. It will help to reduce the mortality and morbidity. And evidence to community bridge, the translate clinical evidence into actionable. What we have understood, or what we have learned, we have teach the community. That is the traditional clinical evidence. And we have community adapted practices. We are also use the different community adapted practices, just like method and engagement strategies, and closing the gap between research and real world caregiving. And smart health innovations we have done demonstrate how smart interventions combining digital tools, just like we have use the digital tools, visual aids we have used, and skilled facilitations also we have used, can drive the measurable public health. Thank you.
Okay, so I would like to ask all the judges, they can continue with the Q&A session, ma'am, with sir.
Good morning.
Good
Hello.
morning.
Hello. Am I audible?
Okay. Badmi. Yes, ma'am.
Yeah. Can you again show me your statement? Just a statement.
Yes, yes.
Manisha, here I am interrupting.
First line.
Can you see, ma'am?
Yeah. A structural maternal engagement as a smart preventive strategy against acute respiratory infection under 5 children. Okay. What have you selected for the inclusion and exclusive criteria?
Inclusive criteria, we have selected the mothers, those who have in the community area, especially those who mothers having below under 5 age children. Exclusive, we have selected those who doesn't know about the English, Hindi, and most probably the Hindi language, or those who have need more. Most probably, we have selected the primary gravida mothers.
Okay. Primary gravida.
Yes,
Any
ma'am.
age
Actually, ma'am,
criteria?
age criteria, age criteria below 35.
Below 35.
Actually, ma'am, if you are giving the primary gravida mothers, if you are giving more in this maternal engagement strategy to the primary gravida mothers, it will be better for them. Actually, they don't know. Some most of the mothers they don't have grandparents, or they don't have proper health educators. That's why we need proper health educations. Actually, before I was.
Have you find any correlation like in your tool, like family or something? Joint family have a more knowledge, or maybe nuclear family.
Joint family have more knowledge, but the problem is that current days there is not joint family. Most of them are living in a separated, and that's why there'll be chances for high AR also. This is also one of the co-factor where we have done the data collections. We understood that there'll be because of the lack of the paternal or parental knowledge, because our grandparents have the more knowledge about ARI and all the things. They explained about how to do all the things, how to take care. But the current days in hilly area also, the primary mothers doesn't have the knowledge, because they are staying in the separated, and they are staying in a most probably nuclear families, and that's why it will be difficult.
Okay. Thank you so much.
Thank you.
Good morning, Midin sir. I am Professor Shilpa over here.
Yes, ma'am.
Sir, you have selected a very good topic, because as we all know that under 5 children are main source for acute respiratory tract infections. So whether you have selected primary gravida mothers, right? No, sir. So whether you have an education, like whether you have health educated the mothers regarding the breastfeeding, because as we all know that it is one of the most important components that prevents acute respiratory tract infections along with the acute gastroenteritis. And most of the children are coming to the clinical with those two symptoms also. So whether you have given the health education on that also, sir?
Yes, ma'am. It is the right question, ma'am. Just because of this one also, I have selected this topic. I have worked in Uttarakhand in a 2,000 bedded hospital in Sri Mahandindrash Hospital, and where I have seen that those who mothers having not properly breastfeeding, they have chances for the high ARI infection. That's why I have selected this topic, and we have given a proper health education for the mothers for the breastfeeding practices up to most probably breastfeeding, exclusive breastfeeding. We have informed them. Because of some job works and some other activities, the mothers are not doing in a proper breastfeeding practice, and they are telling that we don't have breast milk, and actually they have breast milk and they don't know how to do the correct position, or that all happened. We have teach them how to do the breastfeed, how to take care of the children, and with proper hygienic practices they want to take care. These all we have given the health education.
Great, sir. Thank you, sir. Thank you for selecting this topic.
Thank you.
Good morning, Vidyan sir.
Yes, ma'am.
It's a good presentation, and it's a very apt topic where among rural population and as well as in community where it is a needed one.
Yes.
May I know what made you to select this study, and also whether your intervention included respiratory hygiene practices also?
Respiratory health practices we have included, ma'am. We have teach them what are the primary causes and what are the primary symptoms for the acute respiratory infections. If you actually, ma'am, if you are not teaching the what are the complications or first symptoms for the acute respiratory infections, the mothers doesn't know about the conditions.
Okay. So how long your intervention was given, sir? Like as it is the education. So once was enough, for how many times you had
No, no,
given the
ma'am.
intervention?
We took 1 month. Then we have 300 participants. There'll be control group is 150 and experimental group is 150. And we went to different PHC in our area, and we talked with them. I am also working in the community area for NGO and all the things, and that's why I went with that area, and we teach them, and we have collected the data, and we have supported them.
So what was the attrition rate?
Attrition rates, ma'am, most only 85%, ma'am.
5%. Okay. Okay, sir. Thank you.
Thank
Hello.
Yes,
Good
ma'am.
morning, sir.
Good morning, ma'am.
Hello. Good morning.
Can you hear me, sir?
Yes, ma'am. Yes, ma'am.
My name is Dr. Satya. I'm principal of College of Nursing, Kerala.
Yes, ma'am.
So,
Yes, ma'am.
any difficulties do you face when you are doing the data collection period?
Yes,
Whether
ma'am,
you
we
got
have,
adequate sample? What is your sample size?
my sample size is 300, ma'am.
300. Okay.
Yes.
Any problem faced, sir? Whether you got adequate sample?
We got
Because you
adequate
have
sample.
taken only primary gravid mother, right?
And ma'am, actually, we have connected with Anganwadi mothers. Sorry, Anganwadi health workers, and they call them to health educations. Actually, they are going to in different areas, and they call in the one places, especially in primary health center, and we went there and we teach them. Actually, I am also working with NGOs, and that's why the Anganwadi workers are supported.
So directly face to face, you have thought about the structured maternal engagement
Yeah.
in our smart strategy.
In between randomly we went to someone's home also. Just randomly we went, just surprisingly we went to one home, and we asked to them to just do the follow up, and just what we have teach, just we have explained in the home also, and they have done in the home practice also. They have shown that maternal engagement strategy in the home side also. Actually, we want to
Only
do
you have
follow up
assessed the
also.
knowledge or you have assessed the practice also, sir?
Both we have assessed.
Assessed the knowledge as well as practices.
Actually, if we are only assessing the knowledge, it will not completed. We want to assess the practice also. Actually, it is on practice based.
Okay. What is the duration of your data collection? Whether you got time to assess the knowledge as well as practices both?
Yes, ma'am. 1 month we took. It will be completed 30 to 35 days.
Okay, sir. Thank you.
Thank you.
Hello, this is Dr. Gargi.
Yes, ma'am.
Sir, I have a question for you. It's a very good study. Actually, I've done so many interventions, but whether you found any constraints, because you said you had to identify the mothers, and secondly, it is a smart strategy. So whether the mothers were able to use, like you said, you have WhatsApp group plus the other health education techniques. So can you just
ma'am. They have used, but some difficulty we have. We have problems with some doesn't have the mobile phones. They have used the husband phone, and sometimes it will be difficulty also in the hilly areas, and we have faced a lot of problems. But it will be a good study. That's why we have done that study, and we have given the proper research to evidence-based practice we have done.
Okay. So except WhatsApp group, what other like smart things were involved in this research?
Actually, we give the health educations with the video, and also we have done the PPT presentations, and also we have shown the pictures how to take care of the babies. Breastfeeding practice also we have shown the pictures, and our female faculties, I took female faculties also how to do the breastfeeding positions, and these all the things we have taught.
Okay, so you had groups like when you were giving
Yes,
the.
yes. Actually, I'm working as a principal, and that's why I took
Okay.
my faculties also,
Yeah,
because
yeah.
females having more compatible with females.
Right, sir. Okay, sir. Thank you.
Sir, good morning, sir. This is Purna from Bangalore. I'm working as a principal from Santosh Institute of
Yes, ma'am.
Nursing.
Yes,
First of all, I need to appreciate it was a very good study which is carried out both in the community setup as well as in the hospital. And it's not an easy thing because
Yes, ma'am.
getting the primary gravida mothers and bringing them to adopt the phone, digital models, everything, and getting the answer from them is really difficult task. So I want to appreciate for that.
Thank you,
Sir, I want to know that what type of the model you have used for the study, sir?
Ma'am, most probably we have used health belief model. We have used.
Okay. Okay, fine. And sir, as it is a cultural, as it is a community setup, and you have went to the PHC to target the samples as well as the hospitals where you got tie up and all. So in the cultural, because cultural way, it is quite difficult to take the things, no sir. So how you, it's a challenging things, right? So how you
Yes, ma'am.
adapted to focus on the culture, because a multicultural approach is maybe there in the community setup, right? No sir. So
Yes,
how
ma'am.
you underwent for that? What are the challenges you have faced for the study?
Before, ma'am, actually, just I'm a PhD scholar in Usha Martin University. My PhD guide, actually, I have selected the hospital side, but my PhD guide also, madam, is explained that if you are selecting in the community area, it will be good for them. That's why I selected community also, and a lot of challenges happened, but actually, finally, we got the good results. It will be a good study also. That's why we have selected, and most of the mothers, those who having communications problem, they actually we reduce the jargons, and while they are not, some mothers, so they are not accepting the breastfeeding practices because they have
Yeah,
official,
yeah,
and
I can understand.
they have a lot of problems in the home, and that's why sometimes they are, because of the fashion style also, they are telling that we don't want to give up to 3 months, we will give the breastfeeding practices, then afterwards we will not give the breastfeeding practices, and we don't have the breast milk, and these are the main problems we faced, and that's why we give priority to the breastfeeding practices. Through breastfeeding practices, we can easily reduce the acute respiratory infections. That's why we
Yes,
give
sir.
priority to more teaching about the breastfeeding practices.
Okay, sir. Very, thank you, sir. Sir, I hope that you have taught about teaching about the breastfeeding techniques and importance of breastfeeding
Yeah,
also.
yeah,
You would
yeah,
have,
yeah. Yes, ma'am. That's why I'm telling you. We went with the faculties, and they have teached. Actually, there'll be a separate area. They have, and they took what 10 mothers, and they have teach how to take care of doing the breastfeeding, and how, what are the positions they have teached with their own babies.
okay, sir. Thank you so much, sir. All the best, sir. Thank you, sir.
Thank you, ma'am.
Hello, sir.
Yes, ma'am.
Yes.
Myself, Dr. Meena Pagarwal.
Yes,
Sir,
ma'am.
just as you have already given the answers to all the questions, just a little question. What are the further recommendations of your study, sir?
Ma'am, the further recommendations are to give it. It can be most probably important for the this research can use for the nurses as educators. We can in the community linked workers also we can give these research results, and they will understand what are the problems facing the primary gravida mother, especially in the community workers. They are directly going to the community areas, especially in Angan. I have what I have done is that I have given the report in Hindi, and just I
Yeah.
have given to the Anganwadi workers, and they understood what are the problem the primary gravida mothers are facing, and through that we can improve. If we can do more research also for about regarding this, and we can give more strategies regarding this.
Okay. Just one doubt also. Have you selected the mothers whose baby is already having the acute respiratory infection, or all the under 5 children?
Ma'am, separately, I didn't selected those who having ARA infections. In that also 20 to 25% that they having the ARA infections.
Okay. Actually, you have selected the purposive random sampling, na? Purposive convenient
No,
sampling technique, na?
because of my main purpose is that to teach the primary, especially in primary gravid mothers. That's why mothers I have selected those who having under 5. That is why I have selected the purposive sampling.
Okay, okay. Thank you so much, sir.
Thank you.
So I think the QA session has ended for the first participant, Dr. Midun Kurian, sir. So I would like to request the second participant, Dr. Rajni, to just present their paper over here that we can continue with the session.
Yeah.
So Dr. Rajni.
Ma'am, I would like to thank
Yes.
to all the evaluators because they have guided me, and I got more knowledge from their questions and suggestions. And I would like to thank to all evaluators. Actually, I am working as a principal in Uttaranchal College of Nursing, Uttaranchal University. I would like to welcome all. If you are interested, you can come to Dehradun and you can visit our university, Uttaranchal University. And thank you all.
You're most welcome, sir. So, Dr. Rajni, are you available there? So we can start up with your presentation, ma'am. Okay.
Hello.
Yes, Rajni, ma'am.
Ma'am, give me 5 minutes. Let me adjust the screen and all.
Okay, ma'am. You can take your time. Rajni, ma'am, if it is taking time, then I will ask the other person to start with the session, presentation, ma'am. So, okay. Yes, Rajni, ma'am.
Ma'am, you can call the next participant, please.
Okay, fine, sure. Then,
After this, I will start.
Sure. For the next presenter is Shamsheer Begum, ma'am. Ma'am, so you can continue with your presentation. Shamsheer Begum, ma'am, are you there?
Madam, good morning, everyone, madam. Madam, kindly give me half an hour time, madam, please. Mine
Okay,
is
fine.
poster presentation, madam.
Okay, fine. No problem
Thank
for
you
that.
very much, madam. Thank you, madam.
Yeah, you're most welcome. So the next presenter is Jovita. So are you ready with the presentation, Jovita? I think she is also not ready. So the next one is the Lavanya. Lavanya, are you there? Available?
It's visible.
Yes, now it's visible, ma'am.
Yes, ma'am.
Okay. Good morning, everyone. Am I audible, ma'am?
Yes.
Good morning, judges, and good morning, JR Foundation and ICHER organizers. Today, my study title is AI Flipped Classroom, Reforms in Nursing Curriculum and Education. Myself, Dr. Rajni Thaba, Assistant Professor in Shri Mata Vaishno Devi College of Nursing. AI in education. We know that AI is now playing a growing role in education. So in nursing, the program must evolve continuously to keep pace with changes in healthcare. So teaching method must be updated so that the graduates are prepared in a modern clinical realities. And the tools such as personalized learning module, AI-driven tutoring system, predictive analytics for skill development should be used to build knowledge and skills more effectively. And alongside these changes, we should consider the learner's need, because in research studies, Turner shows that the Gen Z learners raised in the digital environment, and they are technologically fluent, and they are open to change in this environment. And they can benefit from the AI supported learning, such as engagement and skill development. In nursing education, there is one more innovation which is called flipped classroom. In this, the learners review the content before class time, and the class time can be used for the discussion and the critical thinking exercises. So, and various researches shows that this flipped classroom method improves the satisfaction and the student performances. On the other hand, the other traditional method, which is lecture-based method, it restricts the interaction and the feedback among students. So based upon these strengths and weaknesses, there is a lack of direct comparison between AI supported flipped classroom and the traditional flip. So we decided to undertaken these studies to compare the AI enhanced flipped classroom method, traditional flipped, and lecture based method on the academic performance in teaching endocrine disorder among second year BSc nursing students. This is the problem statement. An experimental study to assess the effectiveness of AI flipped classroom compared with traditional flipped and lecture-based method on the academic performance of second-year BSc nursing student in the topic of endocrine disorder. These were the objectives of the study. First, we have assessed the baseline student performance level across all three groups. Second objectives were to assess the effectiveness of three instructional methods on student performances related to endocrinal disorder by comparing the pre-test and post-test. Third objective were to evaluate the improvement in student performance across different time span, post-test 1 and post-test 2 among students taught by three different instructional methods. Fourth objectives were to compare the level of student engagement across three instructional methods on post-intervention score from a 23rd item, 5-point Likert scale engagement questionnaire. Fifth objective were to explore and analyze the student perception regarding the effectiveness of AI facilitated flipped learning compared to traditional flipped and PPT instructional methods. In material and method, the research design was true experimental design in which there are three groups: experimental group 1, 2, and control group. The setting of the study was lecture theatres and classroom of the selected college. Study participants are 57 BSc nursing second year students, which are equally divided into the three groups. And the sampling technique adopted for this study is the systematic random sampling technique. And the material used for this study is the instructional tool and the evaluation tool. In instruction tool, animated video lectures created with Canva and shared in the YouTube channels. Interactive flowcharts, structure slide for organized delivery, evidence-based modules based on online resources, and digital flashcard, Quizlet quizzes, and fun practices. In the evaluation tool, the student study engagement tool was used. Knowledge and critical thinking exercises were used. Data collection procedure. Day 3 to day 14 is the intervention phase. Control group is the lecture PPT in which conventional PowerPoint lectures were used. In experimental group, which was the traditional flipped, pre-class readings material was provided, and in-class problem solving exercises has been taken. In the experimental group, AI flipped method, animated video lectures, interactive evidence-based modules, Quizlets, gamified quizzes, and in-class problem solving activities were conducted. Data collection procedure, day 1 pre-test administered, in which knowledge and critical thinking exercises were assessed as a baseline parameters. Day 3 to day 14 was the intervention phase. Day 15 is the post-test 1, immediate to assess the immediate learning outcomes. Day 30 was the post-test 2, which is retained learning outcome, and student feedback and engagement survey via the Google survey has been conducted. In ethical consideration, The ethical permission was obtained by the Institutional Project Evaluation Committee. Written informed consent was obtained from all participants prior to data collection, and participant was entirely voluntary and responses were kept confidential. Next, move to the results sections. Here are the groups which were allocated. Students are allocated among groups. Control group is PPT instruction method. Experimental 1 is traditional flipped instruction method. And experimental 2 is AI flipped instruction method. And the sample size are 90. This is the first objective, assessment of baseline student performance level across 3 instructional groups using achievement test before intervention. And it shows that in pre-test, the mean of control group is 36.5, in experimental 43.11, and in experimental 45.05. And when we run the ANOVA test, the F value is 2.61 and the P value is 0.084, and the P value is more than the 0.05. It means the difference in at baseline is not statistically different. In the second objective, we find the immediate effectiveness of all 3 instructional methods, and in this we compare the mean knowledge score of students immediately after intervention, which is post-test 1. This is the pre-test mean. What happened? This is pre-test mean. In control, experimental 1 and experimental 2, this is post-test 1 mean in all 3 methods, in all instruction method, and this is the gain from the pre-test to the post-test. In control group, this is 4.95. In experimental 1, it is 11.42, and in the experimental group 2, which is AI flipped, is 22.95. And it shows that it is the highest score in AI flipped methods. Slide is...
Yes, it's moving, ma'am.
Okay. Next is, after this post-test 1, we have conducted the post hoc pairwise comparison and also calculate the Cohen's D values. And in this also, the AI flipped versus PPT shows the mean difference of 27. AI flipped versus traditional flipped, the mean difference was 13.47. And in traditional flipped versus PPT, the difference is 13.53. And if we see, the highest mean difference is in AI flipped versus PPT, and in AI flipped versus traditional flipped is also high, which is 13.47. And if we see the Cohen's D values, and it is 3.11 in AI and PPT, 1.49 in AI flipped and traditional flip, which is very large value. Slide is moving, ma'am.
Yes, ma'am.
From my side, slide is not moving, ma'am.
You just check it, ma'am, once.
Next.
Ma'am, kindly double click on the slide.
Is it visible, ma'am? No?
It is visible now.
Just use this button.
So, Moving to the next objective. In this, we have compared the mean knowledge score of student across different 3 instructional methods at different assessment level, which is post-test 1 and post-test 2. If we see this in post-test 2, in PPT method, actually,
If you want, then share yours, ma'am. Yes, you can continue.
Okay, in this objective, we have found the comparison of mean knowledge score of students. In post-test 1, the mean of control was 41, and in post-test, the mean of control was 38. And when we calculate the retention between post-test 1 and post-test 2, it was 92%, and there is a retention loss of minus 2.95 in control group. In experimental group 1, the mean was in post-test 1 is 54.53, in post-test 2 52.47, and if we see the gain between this pre-test 1, post-test 1 and post-test 2 is 9.36, and we calculated the retention percentage, it was 96.22%, and there is a retention loss of minus 2.06. In experimental 2, in post-test 1, the mean was 68, and in experimental 2, which is AI flipped, the post-test score mean is 67, and the gain shows as number is plus 21.95. The retention percentage is 98.53, and the retention loss is minus 1. And when we compare this mean knowledge score among all these 3 groups, it shows that the highest retention percentage is in the experimental 2 group, which is AI flipped method. In the next objective 4, which compared the student engagement across 3 instructional methods using post-intervention score from a 23-item Likert scale questionnaire, which is student engagement scale. Student study engagement scale. In this graph shows that this group, blue color is the group A, which is PPT based lecture method. It shows the engagement score is 71.42%, and group B is this one 93.81, shows the mean of student study engagement score, and group C is the mean score was 103.74. And this graph also shows that group C receives the highest engagement mean score, and this is AI flipped method. Our 5th objective was to assess the student perception in a qualitative way regarding different instructional methods after the intervention. The group A students perceived that this PPT lecture-based method is provided the disengagement and creating a boredom, and the students wants a desire to change this method. And in group B, which is traditional flipped, in this the student perceived through this method they have learned deeply. They valued the preparatory notes and the group discussions. They felt very good. And in group C, AI flipped perception, students feel interactive, motivated, and personalized teaching they have received. So according to these results, here is our discussion. It proves that digital supportive flip model produces the strongest gain in knowledge, engagement, and perception. And when we found the retention and engagement, again, the AI flip method maintained the highest scores and motivation across time compared to other methods. And the student feedback and literature also shows that students prefer the interactive team-enhanced learning, and all these findings consistent with the prior study results. And if we see the implications of AI flip learning for the students, it improves the AI flip learning, improves the knowledge, retention, engagement, and satisfaction. And for educator, it enables the interactive personalized teaching beyond lectures. According to the institute, AI flip learning helps and strengthens the teaching effectiveness and clinical preparation. And in curriculum designer, it encourages the use of modern student-aligned tools. The limitation of this study is the study is focused only on the one content area, which is endocrine disorder, and the study duration is of short duration of data collection, 2 months only, and the small sample size from a single institution, which limits the study generalizability. Here is our conclusion. Digital innovation strengthened the future of nursing education, as digital support of flipped classroom was the most effective in improving the knowledge, retention, engagement, and satisfaction. And the modern digital tools added interactivity, personalization, and sustained motivation beyond traditional flipped methods. And innovative teaching methods should be used more often in nursing and health sciences and educations. Thank you once again, ICHER and the GR Foundation, for giving me an opportunity to present my paper. And here are the references which I have used for this study. Thank you once again.
So I think the QA session is there. So like Purohit ma'am, Gargi ma'am, you can continue with the QA session with the participants.
Okay, good afternoon. This is Dr. Gargi.
Good afternoon.
Yes. Can you let us know what you, according to you, because you have implemented both the methods for the experimental group, what would be the reasons for better scores with the AI flipped classroom?
Pardon, ma'am, once again.
I'm asking, like, what, according to you as a researcher, you found were the major reasons for, the students were getting better scores with the AI flipped classroom?
Okay, ma'am. For this reason, ma'am, nowadays students are using this AI in making the assignments, making the case studies in nursing care plans. Everywhere they are using this one, AI. So I thought when we use AI in teaching the students and to see the impact of this in learning.
So what was the difference between the traditional flipped and the AI flipped classroom?
Okay, ma'am, in traditional flipped, we just provide only the pre-class material, just only the PPT or only the notes in hard copy. But in this AI flipped, we have provided the animated videos which we teacher has made, and some Quizlet apps we have used, Anki app and Quizlet app, Kahoot app we have used. In this, students can learn in a fun way. There is a students team and they can, there are a practice exercises and they can give their answers.
Okay, the animated videos, they were teacher made, right?
Yes, ma'am.
So they were validated before you used in the research?
No, ma'am, I did not validate it. I made that through the Canva app.
Okay, okay. And you also mentioned in the analysis regarding the retention percentage.
Yes,
can we
ma'am.
know how it was calculated?
Yes, ma'am. From the post-test 1 to post-test score, difference between the post 1 and post-test 2 scores. We have conducted the two post-tests. One is on the 15th day and second one is on the 30th day, and the difference between them. And what is the score? And we have converted into the percentage.
Okay. Okay, thank you.
Thank you, ma'am.
Good morning, ma'am. Rajini, ma'am.
Good morning, ma'am.
Can you hear me? Yes, ma'am.
Yes, ma'am.
Ma'am, what is the topic you have taken? That is AI flipped classroom. It's a
Yes,
reform
ma'am.
in nursing curriculum and education, right? You had a problem statement.
Yes, ma'am.
Oh, you have conducted a study?
Yes, ma'am. It's completed.
Okay. So, which students you have completed? Have you tried with the AI flipped classroom method?
BSc nursing second year student, ma'am.
Second year, okay.
Because
But
as per
whatever
my
method, no ma'am, we are carrying out, it should be validated, okay. Without validation, how much it is reliable?
because, ma'am, as I am the HOD of this medical surgical nursing department, I thought I have enough knowledge.
Whatever knowledge we are having, it should be validated from someone, ma'am. That then only it will be accepted. There will be the
I
HOD
know.
or principal, whatever. But no, any method we are trying new, but it should be validated, ma'am. Okay. Which are all the methods you have followed out?
For what, ma'am?
Which is the method you followed, ma'am?
Ma'am, for the AI flip method, I
Oh,
use
okay,
the
flip method only, but it is a way of teaching what aviates and coming to the things, no, learning objectives.
yes, ma'am. That lesson plan completely I have made before
Okay.
teaching to the
Uh,
PPT lecture based methods. The full course plan, lesson plan has been made.
okay. It is accepted by the university or your college,
Ma'am, it is accepted by the college
authority.
authority. Yes, ma'am.
That validation, everything you are having. You have taken the validation from your principal also.
Yes, ma'am. Only from the principal.
Only you have applied for second year BSc nursing.
Yes, ma'am.
Okay, what is the result, ma'am? Whether it's useful compared to other method of teaching?
Yes, ma'am. AI flip method is very helpful in increasing this learning among students. The student engagement, retention, everything has increased in AI flip method as compared with the other two methods.
Any difference you have got in the knowledge aspect or result aspect, anything, no, it is apart from the normal one.
Ma'am, retention is improved, engagement score is improved, which we have used during standardized scale. Student study engagement score is improved in AI flip, and student perception also
Improved.
improved.
So how many sample size, ma'am, you have taken? 50 or
57 student, 57
50
student.
students. What is the recommendation you are trying?
Ma'am, my recommendation is this type of AI tools should used in teaching the students.
Okay, ma'am. Okay, ma'am. Thank you.
Thank you, ma'am.
Hello, ma'am. I just want to ask the AI tool names.
Yes, ma'am. AI tool
The
name.
name of the AI tools which you have used.
Ma'am, one is AI animated videos, video lectures.
The name
made
of application. The name.
One is Canva, Canva Whiteboard, Perplexity, Anki Quizlet, Quizlet flashcards, all these things, ma'am.
Okay.
And Kahoot app. Kahoot app.
Okay. So all are licensed version by your university or you have purchased it?
Ma'am, all these are free versions, ma'am.
Okay,
All are
so
freely available in their apps.
okay, so whatever you did, that is just with the free version, not the licensed one.
Yes, ma'am. Only Kahoot is our university version. Others apps are all free versions only.
What you have used in Kahoot?
Ma'am, Kahoot is actually a quiz in which the students can use it in a fun way. We will put the exercises and every student interact there and they will answer it and there's some rewards going to them.
So it is before the classes or after the classes?
Before the classes, ma'am. Before the classes. In class only there is a critical discussion.
Okay. So this is only for the theory classes or you have used for any practical sessions also?
Only theory. Only theory.
And how much time for the theory classes? Give me 1 second.
1 hour only, ma'am.
Yes,
1 hour. 1 hour theory class. Complete
regular
60
1
minutes.
hour. Regular 1 hour. And what is the duration for all?
Ma'am, 15 days. In 15 days, we have completed the 5 major endocrinal disorders.
Okay, only anatomical except you have taken. Only anatomy.
Only endocrinal disorders, ma'am. Medical surgical surgical nursing.
Medical surgical nursing.
Ma'am, in AHN subject, adult health nursing subject in BSc nursing second year student in INC curriculum, there is a one topic, all the diseases of endocrinal disorders. That we have teach the major 5 disorders. Diabetes mellitus, insipidus, hypo and hyperthyroidism, Addison and Cushing syndrome.
Okay. So have you taken the pre-test? What is the different?
Yes, ma'am. Pre-test we have taken.
Pre-test.
Baseline parameter.
Post-test.
Pre-test 1, post-test 1 and post-test 2. We have conducted.
Any major difference in perception changes? Changes in perception.
Yes, ma'am. In PPT lecture-based method, students felt that there is a disengagement in this method, and in AI flip method, students felt very interactive and personalized teaching they have felt.
So what they have used when you are teaching, what they have used, just they have seen the screen, or they have their own laptop or own devices they have used?
No, ma'am. When there is a theory class, we only discuss. There were no PPT. There were no AVAs. We have just discussed what they have got, the pre-written materials, pre-recorded materials. Before class, they have to study in flipped method. 4 or 5 days before, we have provided them all these materials in all 3 methods, and in class only we have discussed the things.
Okay. Thank you so much. Thank you so much.
Welcome, ma'am.
Good afternoon, Rajni ma'am. It's a very interesting topic. So where we used to use the flipped classroom, AI is the new concept. So I'd like to know that what limitations were there in your study, and what challenges have been faced in implementation of this one, and what were the tools you used?
Okay. First, ma'am, in tools, for the pre-test and post-test student academic performance, we have used this knowledge and critical thinking exercises. Knowledge questions in MCQ form after every disease conditions, and critical thinking exercises, we have make the case scenario and student has to answer. One tool is this one. Another one is a student study engagement scale, in which we have assessed the students' engagement score among all these 3 groups. And third one is the student perception, we have assessed in a qualitative way. The limitation of these studies, we have taken only one topic, which is endocrinal disorder, and this study is limited with small sample size, which is 57, and it is conducted in only single setting in our college only. This is college level study.
The challenges, ma'am?
The challenges which I faced, that it is the scheduling of all these lectures. It is we have collaborated with the class coordinator, and we have adjusted our lecture according to our intervention plan. This was the main challenge which I felt during that time. Class adjustment was little difficult that time.
Okay, ma'am. Thank you.
Ma'am, one more doubt, ma'am. Only for one unit only you have covered, no?
Yes,
That is
ma'am.
only
Only 5
endocrine
disorder.
only.
Only
Only
endocrine.
5 disorder. Only endocrine system only you have covered.
Yes, ma'am.
Okay. Okay.
Thank you, ma'am.
Excuse me. Ma'am, just one query. How
No
have you
problem.
collected the qualitative data?
Ma'am, after completing this posters too on student academic performance, we call the student one by one and collected their feedback. How did they feel about this method? All students in different groups.
Okay, so any specific qualitative method was not used for the.
No. Simple.
Okay.
Rajni ma'am, one question. What is the major difference you have found in the traditional way of teaching along with this AI flipped classroom teaching?
Ma'am, in AI, if we see, definitely in AI flip, when we make about this teaching material, it is time consuming. It needs a lot of time for the teachers. And in PPT method, the students, I think there is a big group, 57 group is very big. And when we divided these students in 19 groups, so it is very easy to engage with them and give them the personalized learning. Even though in PPT group also, lecture-based method group also, student was in 19 group, and they have they have enjoyed the learning. They have discussed as in 50 larger groups when they are in 57 group. So I think this was not the challenge. I felt that when in PPT also, if the students are less in number in small sections, so it can also be effective.
So as you said, like endocrinological disorder, see, as per INC syllabus, if there will be some hours mentioned, right? No, ma'am. So you were saying
Yes,
like that hours are completed within that specific time.
Yes, ma'am. Yes, ma'am. In INC, they have written endocrinal disorder is of 12 hours.
Okay, so it has been covered within this AI
Yes,
flip
ma'am.
class.
Whole syllabus. That's why we have chosen that unit, 12 hours unit, and all disorder we have taught to the student, which have listed in the curriculum.
Very okay. Thank you.
Rajni ma'am, very good afternoon. Ma'am, my question is like you using the AV tools, AI tools is very good attempt, but my question is like ethical regarding the ethical and professional practice and all, how we can prevent academic dishonesty, ma'am, because we tutors, we professors and all, we used to teach based on the INC syllabus, right? And
Yes, ma'am.
because you say that it's already pre-planned and it was recorded video right now, ma'am. In between, the student is asking some other doubts. How this AA will be helpful to clear the doubts immediately in the students?
Ma'am, yes, ma'am. This is a very good features in Quizlet, Anki app, and Kahoot app. Students can, whenever students will any doubt, they can click there, and the message will go to the teachers, and teachers
Okay.
can absolutely answer there. Whatever their question is, in the chat box question will appear, and student can answer according to the student this one mindset.
Ma'am, and one more
This,
thing also I would like to ask, ma'am, especially this AA, especially you covered endocrine disorders right now, ma'am. It also
yes, ma'am.
has some of the practical aspect in the clinical scenario, right? How it is going to help in the clinical practice? Because academic part, I do agree, ma'am, because we are relying on this AA practices, which is very good. But apart from that, as ma'am Satya ma'am said, when the endocrine hovers and all, it's a big topic right now, ma'am.
Yes, ma'am.
It's very big topic,
Yes, ma'am.
and a lot of procedures will be there, which is associated with the endocrine disorders. How this A is going to help in students to carry out this clinical practice in the clinical area, ma'am? Whether you have tried for that, ma'am?
Yeah, ma'am, I did not explore the clinical practice skills here in this study, but after all these observation, I definitely say when we give the critical thinking exercises like in simulation scenarios, students have improved a lot in this method. In
Okay, ma'am.
MCQ,
Okay.
also there is a reasoning question, clinical reasoning questions was there, not only simple MCQ.
Okay, ma'am. Okay. That's it, ma'am. Thank you, ma'am.
Okay, ma'am. Thank you, ma'am.
So, like, I think all the judges, they have asked the question to Rajni Thapa ma'am. So we will continue with the next one. So, Lavanya ma'am, if you're ready with your PPT, I will share your PPT right now over here.
Sure,
So you
ma'am.
can continue with the things, ma'am.
Okay, ma'am. Thank you, ma'am.
Lavanya ma'am, are you there?
Yes, ma'am. I'm there.
Yes. So I will continue with your topics and all. You just continue.
Okay. Shall I start, ma'am?
Yes, ma'am.
Good afternoon, panel members. And I'm Lavanya, an associate professor at Geetham Institute of Nursing, Visakhapatnam, Andhra Pradesh. And the study what I have selected here is effectiveness of mobile health intervention in improving the chronic disease self-management among adults in the selected urban communities, Visakhapatnam, Andhra Pradesh. Next slide, ma'am. So here, coming to the introduction, the non-communicable diseases such as diabetes mellitus, hypertension are the major contribution to the morbidity and mortality. Globally, urbanization has significantly increased the sedentary lifestyle, unhealthy dietary practices, stress, and reduced physical activities, leading to the higher burden of chronic diseases in the urban population. Despite better access to the healthcare facilities in the urban area, effective disease control remains a challenge due to a poor medication adherence, irregular follow-up, and lack of sustained motivation for the lifestyle modification. With the increased smartphone penetration and digital literacy in the urban communities, the mobile health interventions provide an innovative and cost-effective strategies for the chronic disease management. The community health nurse can utilize SMS reminders, WhatsApp education, messages, and telephonic follow-up to reinforce the self-management behavior and to improve the clinical outcome. Therefore, this study aims to evaluate the effectiveness of nurse-led mobile health intervention in improving the chronic disease self-management among adults in the selected urban communities. Next slide. Coming for the need for the studies, there is an increased prevalence of diabetes and hypertension in the urban communities, poor long-term adherence despite of availability of facilities, rising the healthcare cost, high mobile phones and WhatsApp usages in the urban population, need for the nurse-led intervention, digital intervention in primary care, limited urban-based qualitative studies in the Indian context. Next slide, ma'am. Coming for the review of literature, recently the literature is strongly supported for the present study by demonstrating that mobile health interventions are effective in improving the chronic disease management outcome. Studies Chia et al. In 2024 and Ferrari et al. In 2024 reported that the mobile health intervention was significantly improved the treatment adherence and the glycemic control among the patients with the chronic disease. Similarly, Huda et al. In 2025 highlighted that effectiveness of digital health strategies in managing the diabetes and hypertension with the Indian population. Further, Liu in 2025 found a significant reduction in the blood pressure levels through the mobile-based health intervention. Importantly, Kenny in 2025 and Elhey at 2025 emphasized that health professional or nurse-led digital intervention produce the better patient outcome, which directly supports the nurse-led approach adopted in this present study. Moreover, Jingyang et al. In 2026 and Rossman et al. At 2026 confirmed that the telehealth and digital communication enhances the patient engagement and self-management behavior aligned with the findings of the current research. Next slide. Coming for the objectives of this is to assess the baseline level of self-management practice among adults with the diabetes mellitus and hypertension in selected urban communities. Second one is to implement the nurse-led health intervention program include health education, messages, medication reminders, and telephonic follow-up. To evaluate the effectiveness of health intervention on self-care management practices, medication adherence, lifestyle modification behavior. To assess the changes in the clinical parameters like blood pressure and fasting blood sugar level before and after the intervention. To determine the association between the post-intervention self-management score and selected demographic variables. To identify the role of community health nursing intervention in promoting the digital health based on chronic disease management. Next slide, ma'am. Coming for the methodology, it is evaluative qualitative approach and research design is pre-experimental one group pre-test and post-test design. Setting was selected urban communities. Population is adults diagnosed with diabetes, mellitus, and hypertension. Sample size 150 and sampling technique was a convenient sampling technique was being used. Coming for the inclusion criteria, the participants were diagnosed with diabetes and or hypertension, residing in a selected urban community, having access to the mobile phones, able to read the SMS or to understand the voice calls. The exclusion criteria is critically ill patients or unwilling patients have been excluded from the studies. Coming next slide, ma'am. Coming for the result and analysis. According to the demographic data distribution of adults, it was around the age group of 41 to 50 years of age group. They're having 30.7% were having this, and coming for the gender, females are at 58.0% and educational status. Moreover, we are seeing that secondary education status people are having 32.0%. Next slide. And coming for the occupation, the private employees, most of them are having 30.7% are having this chronic diseases. And the chronic diseases, mainly we can see the hypertension was more than about 62.0 and duration of illness was more in 5 years to 10 years of people are having this duration of illness is 40.7. And the mobile phone usage as smartphone users are 108, it is 72% people are having this smart mobile phones. Next month. And monthly income, it was mainly onto the 20,000 to 40,000 people are having 39.3% are having this family income, and most of them are been with the hypertensive problem is there. Next slide, ma'am. Then coming for the pre and post test score between this, pre-test score says that it was the score significantly improvement after implementing of mobile health intervention. The mean post-test score was 69.8 plus or minus 6.1 was higher than the pre-test score was 44.6 plus or minus 7.2, and the calculated pair t-value was 19.25, was statistically significant at base 0.05 level, indicating that the mHealth intervention was effective in improving the chronic disease and self-management among the adults. Next slide, ma'am. Coming for the comparison of the parameters before and after the interventions, that blood test, the systolic blood pressure in pre-test was 150 mmHg, and coming for the post-test, it was 134 mmHg, and the mean difference was 16, and it shows that it is highly insignificant. And fasting blood sugar, the pre-test it was 172 mg per dl, and with the post-test it was 142 mg per dl, and the mean difference was 30, and the p-value is 0.056, and it is highly significant. So coming for the association between the self-management score with the demographic thing, the education has showed the strongest association with self-management improvement, indicating that the awareness level influences the effectiveness of mobile health interventions. Next slide. And here, when we are coming for the community health nursing with this role of MS, here telephonic follow-up and motivational support has demonstrated higher effective and emphasizes the vital role in community health nurses in sustaining the behavioral changes. So more telephonic thing has been increased in the level of awareness among the people. Next slide. Coming for the discussion, the present study has demonstrated that nurse-led mobile health intervention has significantly improved the self-management practices among the adults with the chronic diseases. Regular SMS reminders, health education messages, and telephonic follow-up enhances the medication adherence and promoted the healthy lifestyle behaviors. And improvement in the blood pressure and fasting blood sugar level indicate that effectiveness of continuous digital support, and the findings are consistent with the previous study shows that the mobile health intervention strengthen the chronic disease management through sustained patient engagement and the nurse supervision. Next slide. Coming for the summary, the quantitative pre-experimental study was conducted among 150 adults in a selected urban community to assess the effectiveness of mobile health intervention on chronic disease self-management and follow-up of 12-week nurse-led intervention. The participant has showed a significant improvement in the self-management practice and clinical parameter. The study was confined that mobile-based nursing intervention are feasible and effective in the urban community settings. Coming for the conclusions, the study concluded that mHealth intervention is effective and practical strategies for improving the chronic disease self-management. The community health nurse plays a vital role in delivering the continuous care through the digital communication, therefore improving the patient outcome and supporting the long-term disease control. And here what we identified that research grant is limited community-based studies were there, the previous slide. Limited studies have been done in the community setting, and there is lack of nurse-led intervention models were there, and insufficient focus was there on self-management behavior. So here what we have been observed as a community health nurse, when we are taking our students to the community, and we have observed that most of the people are not taking the medications in a proper way, and they are saying that the thing has been, the levels are not coming up, and the medicine, whatever the government has been providing, is not working onto them. And what we have observed, and we have done this study, like we have gone to houses. First we have collected all the people, and then we have seen, like, regularly we used to monitor them by what was the blood sugar, blood test, blood pressure monitoring we have done, and after that continuously for that we have been done a follow-up for the participants, and we have seen that whether regular taking of medications, how was the values like before and after, how was the values, and there was a significant improvement that we have seen, like when during the follow-up visits for all the participants, it was likely improved the levels, and they were maintaining a normal levels. This was the thing what we have been found out during our study. Next one. The recommendations are integrating the health strategies into community health nursing practices, conducting a large-scale experimental studies for the stronger evidence, train the nurses in the digital health to tele-follow-up services, and implement the mobile health program under the National Non-Communicable Disease Control Initiatives. Yes, ma'am. And these are the references what we have been taken. Yes, ma'am. Ma'am, with this, it is finished. Ma'am, I have done with my presentation.
Yes, ma'am. So, judges, which
Ma'am,
slide,
can
ma'am?
you show your problem statement?
Yeah, first slide.
Okay, okay, sure, ma'am. I will do it.
Yes.
Ma'am, how many chronic diseases you have included?
It is 150 samples I have taken.
Can you repeat again?
Ma'am, 150 samples I have taken.
No. In chronic disease, what disease you have included?
Ma'am, hypertension and diabetes mellitus.
Hypertension and diabetes mellitus.
Yes, ma'am.
And why you have choose urban community?
Ma'am, when we are posted, most of the people know they are having this hypertension and diabetes was being seen when we have been posted for our community clinicals.
But rural community need more kind of.
Yes, ma'am, because here I wanted to focus on the mobile health intervention. So most of the thing we can see it in the urban rather than in the rural thing.
Okay. And mobile health, that is particularly some you have developed or it is already invented?
It is already there.
Mobile health, that means which have been given by the government services, right?
Yes, ma'am.
Okay, so they used to come in the urban area and they used to put the canopies and all, and the distribution of medication and all, right?
Yes, ma'am. That is ABA app we used to call like, no? Ayushman Bharat.
Ayushman. Okay.
Yes,
okay.
ma'am. Yes.
Okay. So I think it is effective only. That is why government has have been introduced. So what was your motto to
Ma'am,
evaluate?
actually it is effective. The government has been given, but the people are unaware of that one. They don't know what is that Ayushman Bharat thing, app and all those things. They're not utilizing the services, and the complaint what they're saying is whatever the medication is being given by the primary health centers is not effective for them. So that is the statement that they have been given for us.
And same mobile health is invented for the rural community also?
Yes, ma'am. Rural community is also there. But most of the people where they don't have this smart mobile phones and all are not there.
Ma'am, one thing, no, in your problem statement, your study variable is not there, no?
Yes, ma'am.
Okay, so what design you have selected?
Ma'am, qualitative study test. Pre-experimental study, one group pre and post study I have been taken.
Pre and post. But you
Yes.
just have to check the effectiveness, whether they are aware or not. So why you have selected this study of pre and post?
Ma'am, first I want to do it in a small group. Then I can go for the extended group. So only
But
one.
here you have not. Here you are assessing the knowledge or something.
Yes, ma'am. Knowledge and practice also, ma'am.
No, just you are assessing your effectiveness only, no?
Yeah,
Knowledge you
I
are
think
assessing.
statement. I think your statement is little bit confused. If you
Not
are
clear.
assessing the knowledge and practice, so it is about your whatever, maybe you're giving some simulation training, or maybe you're some using some teaching planning, that you're assessing. And according to your statement, you're assessing the knowledge and practice of mobile health intervention, or you're assessing the knowledge of their self, you can say management, self management about the chronic disorder. That little
Yes,
bit
ma'am.
confused.
Ma'am, it is only on the self-management, ma'am. So first I have been assessing their knowledge with the questionnaire, and the practice I have been assessed like whether regularly they are taking or not through the mobile health. And we used to have a messages, we used to have a telephonic things to remind them that they have to take a medications and all.
But
What what is the
how come
application
you
name?
know that, ma'am, whether they have a practice in the home setting? Any evidence, any diary you maintained, anything?
Yes, ma'am. We have maintained the diary. We are maintaining this telephonic recordings and all. We have been doing that, and we are being posted for the community clinicals. So based on that, every time we used to, along with our students, we used to have a follow up and feedback from them whether they have taken or not.
Okay. Okay. Just from my side. Thank you.
Okay.
Ma'am, I have one doubt. Just to assess the effectiveness of mobile health intervention on, no, for knowledge regarding diabetes and hypertension, right?
Yes, ma'am. Yes,
Okay. What intervention through mobile you have given, or you created Google link and you have taken the pre-test, then you have given the intervention. After that, you conducted post-test, or
yes,
what is the method, ma'am, you have used?
ma'am.
Can you
Like
clear?
first we have done a pre-test with the questionnaire and all. Then we
Okay.
have told about like what is the use of medications, medication reminder, some health education we have given on the lifestyle modifications and all those things. And once after telling that also, we had follow up with the telephonic also.
Any
Telephonic
STP
follow-up
you have
also.
provided? STP you have provided?
Yes, ma'am. Like health education, that only we have given for them.
Okay, ma'am. Okay. How far it is reliable? Okay, ma'am. Thank you.
Ma'am, this actually the values have been previously it was more values like blood pressure values and blood sugar values are more, and after regular follow up and telling them a reminders and all the things, then the blood sugar values and blood pressure values have been reduced.
Okay, ma'am. Okay, ma'am. Thank you.
Okay, thank you.
Madam,
Yes.
this is there's one query. Like you said that there is health interventions, and I think you had also mentioned that there are like people who are having even basic phones. So whether that were useful for implementation of mobile health interventions, or only smartphone usage was required, or what? How can you elaborate on that?
Ma'am, smartphones means sometimes no, we'll have video calls and all. We can able to do it, and then we can ask whether they have taken or not.
Right,
So,
but then if you can put the slide, no, I think if I'm not wrong, there are some people with the basic phones.
yes, basic phones were also there. No?
Yeah, so whether you can apply all these interventions to these people also?
Yes, ma'am, we can do it. But the thing is, like smartphone, we can have a video call chatting and all those things. But whereas in the normal basic phones, again, that a video call is not been possible.
So in your study, whether what type of then interventions would you give with the people who are having just basic mobile phones, apart from those who
No,
were
ma'am,
having the smartphones?
no, ma'am. That there also we are giving health education for them. Ma'am. So we are giving health education regarding the lifestyle modifications and all we are telling. And through basic phones also we are making a call and just reminding them like they have to take a medications and all.
Then will it be included in the health type of interventions?
Yes, ma'am, because mobile health only, no, either it is a basic model or it is a smartphone. We are the access what we are using is the phone.
Okay, thank you.
Thank you, ma'am.
Lavanya ma'am.
Lavanya ma'am, it's very
Yes.
nice.
Like if
Many studies has been done like effectiveness of mobile health.
Yes, ma'am, actually
Yeah.
these studies mostly have been done in the hospitals. Whereas in the community, the less studies have been done on it.
Yeah. Like I want to ask you one question. Like you have follow up, you are doing follow up for adherence to the treatment.
Yes.
So how, like as one of the madam has asked, how reliable it is. They may say okay, and they may not take the medicine. They may skip the medicine. So how we have assured that they were adhered to the treatment?
Ma'am, we were checking this blood pressure values and all those things. So previously how it was. So we can able to identify if they are not taking the medications and all. Easily we can able to identify the values have been high.
Okay, only it is about medications, or it also included lifestyle modifications also?
Lifestyle modification is also there.
Okay, how we were screening those lifestyle modifications, whether they have done or not, whether there is an app for that or how, ma'am?
No, ma'am. When we are going for the clinical postings and all, we were just telling previously we have educated them on exercises and all those things.
Just you are you will rely on their opinion. If they say yes, yeah, they have done. If they say no, they have not done.
Yes, ma'am. Yes.
Okay, ma'am. Thank you.
Okay, thank you.
Lavanya ma'am, I have one query.
Yes, ma'am.
See, you whether you were aware of urban people you were taking, right? So whether they were aware about what is Ayushman Bharat, what it is.
Yes, ma'am. Only few people are aware about Ayushman Bharat, but the others, majority people are not aware about this Ayushman Bharat.
So why did you take the why means it is a small suggestion. So why you did select a topic on the giving an awareness about the Ayushman Bharat, because most of the people doesn't have an opportunity to know. Like some they are like rural area or urban area, they will not have an access to the smartphones and all. No. So why you didn't select a topic related to the effectiveness or structured program like teaching about the Ayushman Bharat? I mean, just a query, okay?
Yes, ma'am. Actually, I had done on Ayushman Bharat, and which I have been already presented at AIMS Raipur, one national conference regarding Ayushman Bharat. So
you
already
before you have done that study.
Yes, ma'am. Before already I have done this study on
Okay.
Ayushman Bharat.
Okay, thank you.
Okay, thank you, ma'am.
Lavanya ma'am, I would like to know what are the recommendations you are suggesting for the nursing education as well as the nursing practice, ma'am? Because you said your study is based on the urban settings, right? So
Yes,
may I
ma'am.
know regarding that, ma'am?
Ma'am, actually, we can tell about the digital health to the nurses and all, so that it is useful for them to educate the community people.
Okay. Okay, ma'am. Thank you.
Thank you, ma'am.
So I think the QA session has got ended from all the judges.
Thank you, ma'am, for giving me this opportunity, and it's my privilege that I have been presented on this international conference. Thank you for.
You share the PPT.
Yes. Yes, ma'am.
Have you mailed it to the WhatsApp does, ma'am?
Manisha ma'am, please start the session.
Baljinder ma'am, by the time Manpreet ma'am, are you there?
Okay, ma'am. Yes,
Yes,
ma'am.
ma'am.
I'm ready.
Yes, please share your PPT. Your presentation, ma'am. It's visible to everyone. Is it visible?
Yes, ma'am.
Yes.
Good afternoon, respected judges. Myself, Manpreet Kaur, PhD scholar. Today, I am presenting my poster presentation in front of you. Firstly, the research statement, effect of emotional intelligence training on emotional intelligence, academic and clinical performance among students in selected nursing colleges, Punjab. First, introduction. As we all know that nursing students face various difficulties during their course of study that can affect their learning as well as their academic performance. So as to prepare the emotionally strong future nurses, there is a need to give emotional intelligence training to nursing students. And the objective of my study is to evaluate the effect of emotional intelligence training on level of emotional intelligence, academic and clinical performance among nursing students. Material and methods. It's a quasi-experimental two-group pre-test, post-test.
In the middle, ma'am. Ma'am, you just switch on your camera, please.
Ji, ma'am.
Anji, ma'am.
It's a pre-test, post-test design. A total sample of 346 students have been selected from different semesters of 3, 4, 5, 6 from selected nursing colleges of Punjab like Just College of Nursing, City College of Nursing, Julka College of Nursing, SGRD College of Nursing, Sukhchindra College of Nursing, and Amandeep College of Nursing. And the collected by purposive sampling technique, the students meeting the screening criteria was separated and pre-testing was done with the help of selected tools. After pre-testing, the students meeting the inclusion criteria were selected and interventions were given. Interventions was given for a period of 2 months and post-testing was undertaken after 4 weeks of interventions. Research variable of my study are independent variable is the emotional intelligence program and the dependent variable are emotional intelligence, clinical performance, academic performance. Inclusion criteria of my study are the students of BSc Nursing semester 3, 4, 5 and 6, students having average and below average emotional intelligence willing to participate and having 75% attendance in the clinical and academic area. Exclusion criteria of my study will the students having above average emotional intelligence. Reliability and validity of the tool. After checking the reliability and validity of the tool, main study has been carried out. The various tool that I have used in my study in the section 1 is the demographic profile of students. In the section 2, emotional standardized emotional intelligence questionnaire. In the third one, academic performance of students is assessed by GP, grade point average. And the fourth one, standardized structured evaluation form for clinical performance and its reliability has been found out with the help of Cronbach alpha and it is 0.93. After selecting the tool, procedure of data collection has been carried out. In the step 1, pre-test has been taken from the experimental and control group. Then interventions were given to the experimental group and control group is kept without intervention. After that, post-test of both the groups has been carried out. After post-testing, analysis and interpretation of data is done with the help of descriptive and inferential statistics. Results. This is a table 1, frequency and percentage distribution of demographic variables of students in the experimental and control group. First is the age in year. In the experimental group, mostly 17 to 20 years students are having percentage 64.1 and in the control group majority are from 21 to 24 years, that is 80.1%. In the experimental group, majority are the females, that is 93.5%. In the control group, majority are the females, that is 93.8%. Semester of the course, in the experimental group, majority are from the BSc 4th and 5th semester, that is 26.5%. And in the control group, majority are from the semester 6th, that is 26.2%. Type of family, in the experimental group, mostly are from the nuclear family, that is 71.2%, and in the control group majority are from the nuclear family, that is 75.6%. Habitat in the experimental group mostly are from the rural area, that is 57.6%, and in the control group majority are from the rural area, that is 60.2%. Family monthly income for the experimental group more than 30,000. Majority of the students are having 40%, and likewise in the control group majority of the students 39.8% are having the family income more than 30,000. Attendant training or emotional intelligence, majority, that is 0% in the experimental group, have no emotional intelligence training. Likewise in the control group majority 0% have no emotional intelligence training. Next comes the plot graph. Fox plot graph of emotional intelligence score among nursing students shows that the experimental group has a significant higher median score of approximately 140.5 as compared to the control group's median of about 136. Overall, the experimental group tend to have higher and more consistent emotional intelligence score, whereas the control group shows greater variability and more extreme values. However, to determine these differences, a statistically significant normality and Mann-Whitney U test has been applied. Application of normality test indicate that the data is not normally distributed and thus suitable for non-parametric analysis because all the p values are smaller than 0.001. It indicates that the emotional intelligence score for both pre-test and post-test group does not follow a normal distribution. So the data is not normally distributed and thus suitable for non-parametric analysis. For non-parametric analysis, Mann-Whitney U-test has been applied, and this test helps us to find out the effectiveness and of emotional intelligence training on emotional intelligence, academic and clinical performance. This table suggests that the mean rank for the emotional intelligence is more as compared to the control group. Mean rank for the emotional intelligence is 195.67. For the control group, it is 152.09. For the academic performance, for the experimental group, it is more, that is 2 to 1.32. And for the control group, it is less, 1 to 7.31. For the clinical performance, for the experimental group, it is more, that is 2 to 2.18. And for the control group, it is less, that is 1 to 6.48. This table suggests that there was statistically significant difference in emotional intelligence, academic and clinical performance between the two groups at post-test level, provides the evidence for the effectiveness of emotional intelligence training in enhancing emotional intelligence, academic and clinical performance in the experimental group. Next comes the discussion. Overall, it was observed that almost similar respondents, 28.8% and 22.7%, had low level of emotional intelligence in the experimental and control group. 71.2% and 77.3% had average level of emotional intelligence and 0% had high level of emotional intelligence in the study and control group. Likewise, as the table above suggests that there is statistically significant difference has been found in the academic and clinical performance after training. These studies results are similar with the study of Ramadan et al. That suggests that the pre-test and post-test measures to see effect of emotional intelligence training over the clinical performance of students and reported that there is statistically significant improvement in emotional intelligence and clinical performance after the program. Conclusion of my study says that it can be concluded that most of the participating nursing students had low and average level of emotional intelligence with significant improvement after intervention in the study group, which demonstrated that there was significant effect of emotional intelligence training intervention on emotional intelligence, academic and clinical performance of nursing students. And the implication of this study helps the students to become emotionally strong in clinical field and thus improve the quality of care. So it is recommended that emotional intelligence courses should be included in nursing curriculum to improve the theoretical as well as practical skills of students. Thank you, ma'am.
Good morning, ma'am.
Good morning.
It's a very nice study, which is very useful for our present scenario. Emotional
Yes, ma'am.
intelligence on academic and clinical performance. So you have
Yes,
given
ma'am.
the emotional intelligence training, right, ma'am?
Yes, ma'am.
Which tool you have used or any? What is the training you have given, ma'am? Tell me about the.
Emotional intelligence training has been provided on the four domain dimensions like sociability, well-being, emotionality, and self-control.
Okay.
For this lecture method has been used role play, flashcard, posters has been used to give intervention to nursing students.
Selected which year nursing student you have selected, madam?
Semester BSc nursing semester 3, 4, 5, and 6.
So why you have not included the first?
Because these students are newcomers and their emotional intelligence is automatically low. They don't know anything about.
Can you again show me the statement? It
Ji,
is
ma'am.
actually half cut.
Yeah, ma'am. 1 second. I'll show it.
Yeah, now it is visible. Okay. So second and third SEM you have selected.
Yes, ma'am. Yes.
Any correlation which you have found it regarding the clinical practice or maybe with some particular male or female or age group?
No, ma'am.
Like female have a more
No,
or
ma'am.
compared to no.
No. No.
Any evidence means any review of literature have you found out related to that?
Yes, ma'am.
Correlation?
There is significant effect of emotional intelligence training among the female candidates as compared to male.
Okay, that you have mentioned.
Yes, ma'am.
Okay, it is very nice study. I also liked it.
Thank you, ma'am.
And what about the clinical performance? So
There is improvement of clinical performance after emotional intelligence of students because students came to know how to deal with the stressful condition in the clinical environment.
okay, fine.
जी ma'am.
So you have taken all batches, means full strength, full full
Students
strength of
having
batch. Like in one batch you have, for example, third time you have 100 students. So you have taken
firstly I
all
have
100
kept
students.
जी ma'am. Firstly I have kept the screening criteria. Like the students, I have given them the emotional intelligence questionnaire. Students who are having the low and below average emotional intelligence are selected. And after that, after their selection, inclusion criteria has been found out that whether their attendance is more than 75% or not, they are.
As per their attendance criteria, like if they have attendance more than 75% of classes, you have selected.
जी ma'am.
And why you have why you have set that criteria? What is the rationale behind it?
Because most of the students are absent from the clinical area. I have seen this. So I have set the criteria of attendance in the clinical and academic session.
So, is there any literature review which you have found that low attendance have a low kind of emotional intelligence or something?
Still no, I will try to find out.
Okay, that is from my side. Thank you so much.
Thank you.
Hello, ma'am.
Yes, ma'am.
Can you tell us whether you had taken any specific emotional intelligence like training on that, and then you have developed this training?
Yes, ma'am. I had taken training from the there is one conference in by Indian Nursing Council, and I have a certificate of that training also.
Okay, so that has helped you really.
Yes, ma'am.
Manpreet ma'am, one small query.
Ma'am.
So
जी
you
ma'am.
have selected third, fourth, fifth, and sixth, right?
जी
And these
ma'am.
people are like they are learning about the AHN 1, 2, and even CHN, MHN, everything, right, no, ma'am? So why you
Yes,
did
ma'am.
select seventh and eighth semester? Because eighth semester, as you all know, that they are in the internship period, right?
Yes,
And they'll
ma'am.
be
There.
having the continuous clinical duties also. So why you
Ye-
did select them? Can you
Yes,
just
ma'am.
explain?
There is one point of biasness because these students are having more emotional intelligence. They are as compared to these semester students. First semester are having the lowest emotional intelligence. We know they are new, they are very stressful to the nursing field. And as they move from semester to semester, they learn many things. And at the last, their emotional intelligence automatically get increased.
So you are concluding that the eighth semester and the seventh semester are more fit.
Yes. Yes,
Oh,
ma'am.
okay, okay. So whether you have done a trial on the, like you
No,
have
ma'am.
tested on them.
No, ma'am. I haven't done trial.
Okay, but next study you just have a trial. Okay, because see, for eighth semester, it is just my suggestion because for the eighth semester they are continuously going for the 6 months of like that intense training
ma'am.
period. Even if it is
Yes, ma'am.
GNM or BSc when we are taking. So the third year of GNMs and the eighth semester of BSc, they will be having an intense training period, and we the teachers. We used to say them that you are not supposed to take any type of leave and you should be 100%, you have to have an attendance. So I suggest you to do this same study because this is a very good study and I really appreciate your efforts. Okay, and
Thank you
all
so
the
much,
best.
ma'am.
And
Thank
you
you.
do the study also. Thank
Thank you
you
so
so
much,
much.
ma'am. Thank you. Thank you so much, ma'am.
Manpreet ma'am, it's a good study. Like as Shilpa madam is telling, I want to add on to that. Yes, in fourth year, so at least you can check that whether there is an improvement in their emotional intelligence. Either you can do comparative. One object you can keep it as a comparative between other SEM, like the third, fourth, fifth, sixth with the eighth SEM, so that we can come to know that whether by studying nursing, at least like by studying psychiatry subjects and all. So how about their emotional maturity? You can check for that.
Yes, ma'am. Of course.
Ma'am,
I will keep in mind.
one more thing.
Thank you.
As you have mentioned it as a training, so how many weeks or how many months of intervention has been given, ma'am?
2 months of training has been provided, and after that, post testing was done. After 4 weeks, post testing has been carried out.
Okay, so yourself has given 2 months of training. Is it a daily based training, ma'am?
One day, skipping of one day.
Okay, why so, ma'am?
Ma'am,
Alternative days you have chosen.
yes, ma'am.
Why, ma'am? What made you to choose like that intervention periods?
Because for one college, I am covering one day, and the next day is for the another college.
Okay, okay. So they are not all together gathered at one place. No. So you have selected the places and you have been to the colleges and you have given the intervention.
Yes, ma'am. Yes.
Okay, 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 ma'am. So are you issued them certificates to be a trainers, or you have advised them to join where you have got the emotional intelligence certification?
I haven't, ma'am, given them the certificates.
Okay, ma'am. Okay. Thank you, ma'am.
Thank you so much, ma'am. नहीं आया.
So I
Hello,
think this session
Manpreet.
is also.
Hello,
Yes,
Manpreet.
ma'am.
Yes, ma'am.
Yeah, you have done a very good study.
Thank you so much, ma'am.
And I have a question. Why you have not chosen the first semester student?
Because my study is on emotional intelligence. And I think the emotional intelligence of semester one is low as compared to these semesters. Students are not aware about the clinical area. They are stressful.
So when
I
you
think
have
they're
taken the second semester in the initial period of months,
after they have completed their first semester, the students who are in the second year have selected them.
okay, okay. So you have taken a training of the emotional
Yes,
intelligence.
ma'am. I had taken training. I have
You got
certificate of that training.
okay. So what kind of training you have attended?
It's an online training
Mm-hmm.
by Indian Nursing Council.
That's what basically they taught.
They had taught about regarding the dimensions of emotional intelligence like the sociability, well-being, emotionality, and self-control. How the students have to put control over them when they are in stressful conditions. How they
Okay.
have to put control over their emotions when they see any person in the ward having painful death.
Okay. So in the recommendation we can add to the, I think the first semester students, just to those who are finding a stress and all
Yes,
during
ma'am.
performance in the clinical or in the academic. So they can get the counsel also.
Yes, ma'am.
That
I will
kind of
keep this in
recommendation and
mind.
the comparative study. In the
Yes,
first
ma'am.
semester we can do the counseling, and
Yes, ma'am.
in any semester you can choose. In that time we can give the some of the training which you already have attended.
Ji, ma'am.
That can be done, and then we will get the what lacuna is there in the first semester students, and
Yes,
what
ma'am.
kind of the work we can be provoke to them to learn.
Yes, ma'am.
That can be done.
Yes, ma'am. Of course.
Okay. Okay. All the best.
Thank you, ma'am. Thank you. It's my pleasure.
Ma'am, can I also come to know whether there were any practical components in your training program?
Practical, like for the clinical performance, I have assessed through one procedure like vital signs.
That's for clinical performance.
Yes, ma'am.
Okay, and for academic performance?
Their grade point average, the students who performance in midterm and end term marks.
Okay, midterm and end term. That
End
is your
term.
what could be the university one or the college level?
Midterm are from the college and end term are from the college.
Okay.
Because if these are from the university, this semester get changed.
Yes. Okay.
जी ma'am.
Okay, then if the question and answer session has been winded up, then I will ask the Baljinder Kaur ma'am to just start her presentation and I'll share ma'am's video from here.
Okay, ma'am. I'm ready.
Yes. Yes. Baljinder ma'am, are you there?
Yes, ma'am. Yes.
Okay, I will share it now. Ma'am, you can continue the presentation.
Ma'am, my topic is an exploratory study to assess the knowledge and attitudes of mothers regarding the immunization status of their children under 5 years of age in selected area, Ludhiana. Introduction. The goal of immunizing children against chief disease responsible for child morbidity and mortality is indeed a noble one. However, it is not an easy task to achieve. In developing countries like India, the sheer logistics of the number of the target population that stretches across geographically diverse regions make universal immunization of children a Herculean task. However, the health sector of the country is making admirable achievements in the several millions of potential life through the universal immunization program. In 2014, the United States experienced a record number of measles cases, with 667 cases from 27 states reported to the CDC's National Center for Immunization and Respiratory Diseases. This is the greatest number of cases since measles elimination was documented in the US in 2000. In 2015, 188 people from 24 states and districts of Colombia were reported have measles. In 2016, 70 people from 16 states were reported have measles. In 2011 population in the world with 158.8 million contributing the population of India, WHO data showed that number of children under 1 year of age who did not receive DPT-3 vaccine worldwide, 21 million in 2013 compared to 22.8 million in 2012. Methodology indicates the general pattern of organizing procedures to gather valid and reliable data for investigations, sample and sampling technique, inclusive and exclusive criteria, selection and development of tool, description of tool validity, of the tool reliability, of the tool pilot study, data collection procedures, ethical considerations, plan of data collection, summary. Research design. Research design used in the study was non-experimental. Research design assesses the knowledge and attitude of mothers of the children under 5 years of age regarding immunization status in selected area, Ludhiana, Punjab. Analysis and interpretation. Analysis and interpretations were done in accordance with the objectives laid down for the study. The data was obtained from 100 mothers who have children under 5 years in selected areas of Ludhiana, Punjab. The analysis of data was done in accordance with the objective of the study. The data was analyzed by using description and inferential statistics to mean, percentage, standard deviation, ANOVA test, and correlation coefficient. Objective. First objective of the my study is to assess the knowledge and attitude of mothers regarding the immunization status of their children under 5 years of age. Level of knowledge score. I have given according to the scores of knowledge of mothers. Good, I have given 17. Average, I have given 26. Below average 25. Poor 32. And my mothers having those who have uh, uh, mm, having knowledge like good was the 17%, and average 26%, below average 25%, and poor 32%. Seeking the objective of the my study is to find out the relationship between knowledge and attitude of mothers regarding the immunization status of their children under 5 years of age. I have given knowledge scoring maximum 25, attitude 125. Our mean in this 15.08 and attitude 73.08. First objective in discussion, first objective to assess the knowledge of the mothers regarding immunization status of their children under 5 years of age. The first objective of this study to assess the knowledge of the mothers having children under the age of 5 years regarding immunization. And the highest number, 32% of mothers had poor knowledge regarding immunization. Hence, it was concluded that mothers had lack of knowledge, which was similar to the finding of Sharma Rahul extra all 2007, who stated the maximum number of mothers lack in knowledge regarding immunization. A remaining mother had 26% average knowledge and 25% below average knowledge. Only 70% of mother have good knowledge regarding immunization. According the objective to assess the attitude of mothers regarding the immunization status of their children under 5 years of age, majority of mothers had a positive attitude, 58% towards immunization. According to my objective third, to find out the relationship between the knowledge and attitude of mothers regarding immunization status of their children under 5 years of age, there was a moderate correlation between the knowledge and attitude as the correlation coefficient R was between 0.7 and 0.9, which is 0.8. This relates to a positive correlation. According to objective 4, to find out the relationship of according mothers' knowledge regarding the immunization status of their children under 5 years of age, we selected variables such as mother's age, mother's education, mother's occupation, mother's religion, type of family, number of children, monthly family income, and marital status of mother. Mother's age highest mean knowledge score was 15.5 and was scored by the uh, 21 to 25 years of age group, followed by the 15.13 score by above 35 years of age of mothers, 14.6 score by 26 to 30 years of age, and at least score was 15.41 by 31 to 35 age group. Mother's education. Highest mean score 15.13 was scored by the primary school educated, followed by 15.1 by secondary schools, and above 15.2 by illiterate, and last score was 14.4 by matriculation education mothers. Mother's occupation. Maximum mean knowledge score 15.6 was scored by the private employed, followed by the 14.78 by government employed, and 14.73 by self-employed mothers, and the last score was 14.54 by homemakers. Uh, Mother's religion. Maximum mean score 15.30 was the scored by the Sikh religion, followed by the 5 score by Christian religion, and the least score was 14.4 by Hindu religion. Type of family. More mean knowledge score was 15.1 scored by nuclear family, and the least score was 14.72 for joint family. Number of children. Maximum mean knowledge score 15.33 was scored by the mothers having 2 children under age 5, followed by the 15.02 by 3 and other children group, and the last score was 14.4 by the one child group. Monthly family income. Maximum means for knowledge 15.5 was scored by the above rupees 5,000 income group, followed by the 15.13 by below 3,000 per month income group, and 14.6 by the 4,000 5,000 group. At the least score was 14.41 by the 3,001 to 4,000 income group. Marital status. Highest mean knowledge score was 15.13 was scored by the divorcee group, followed by the 5.1 by the widow group, and 15.02 by married group, and least score was separated groups.
Yes, Balchinder ma'am.
Yes, ma'am. Ma'am, my implications. Finding of the study has several implications discussed below to assess the knowledge and attitude of mothers regarding the immunization status of their children under 5 years of age, discussed in following areas: nursing education, nursing administration, nursing practice, and nursing research.
Ma'am, just now just conclude the session, ma'am.
In conclusion, on the basis of result of data analysis, the following conclusion were reached. 17.5% mother have good knowledge of regarding the immunization status of their children under 5 years of age, and 26% mothers have good knowledge of and attitude regarding the immunization status of their children under 5 years of age, and 25% mother have good knowledge of regarding immunization status of their children, and 29% mothers have good knowledge level of knowledge regarding the immunization status of their children under 5 years of age. Thank you so much.
So judges, you can continue with the question and answer.
Good afternoon, Balanza ma'am.
Good afternoon, ma'am.
So it's a needed study to prevent like a common diseases among the under 5 children. So where the government is taking off vaccination for all the children through the ASHA workers and through the Anganwadi teachers. Then how different you have made? Why you have chosen this study?
Ma'am, this study I have done the slum areas. Because slum areas, ladies have no knowledge. They don't want to go for the vaccines. Like labor women, those who are working in the road constructions, and their attitude regarding immunization, they said there is no vaccination in the PSCs available, and like so this is needed.
Your vaccination, it's included optional vaccines also?
Sorry, ma'am. There. Please repeat the question.
Ma'am, your vaccination schedule, was it included optional vaccines also?
Yes, ma'am.
ASHA workers, they go home to home and they do survey where they have left with the children not done with the vaccination, and even they do go for slum areas also to cover the vaccination. So how you have promoted the vaccination? Might be you have been there or you have taken our other all healthcare workers.
Yes, ma'am. I have done give the pamphlets to the mothers and told the timing to the mothers. This time they will come and you can vaccinate your children. They all time busy in the labor, so they said that we have very less time. Then according to the need of the mothers, I gave the pamphlets and gave the all knowledge about the vaccination timing and the availability of the vaccinations nearby their accommodation.
Thank you.
Thank you, ma'am.
Good afternoon, ma'am.
Good afternoon, ma'am.
So nice study you have undertaken, ma'am, in the slum areas. So
Yes,
after
ma'am.
your study, know whether they have any improvement, whether they have taken the vaccine to all the children, whether did you do the follow up, ma'am?
Yes, ma'am. I have taken follow up after 6 months when I done my study. In post test also I assessed, but after 6 months I went there and asked them. They said we have vaccinate our children as comparative to previously.
Whether you checked that card, immunization card, whether they have taken the
Yes,
vaccine?
yes, ma'am. I have
Okay,
checked the immunization card also.
okay, ma'am. Thank you.
Thank you, ma'am. Thank you so much.
Good afternoon, ma'am. I just want
Very
to
good
know
afternoon.
one thing that you have provided the pamphlet for the mothers, right? So the people who are working, it was a labor mother. So whether they were aware of what is a pamphlet and which language you have done with the pamphlet and whether they were educated. Like, see, only the literate people will be knowing how to read and what is a pamphlet. If you are giving a description also, whether they were able to understand what you are giving. That's the question, ma'am.
Yes, ma'am. I made the groups like illiterate mothers and primary educated mothers, secondary and matriculation and other. Then I gave them pamphlets according to their mother tongue. And illiterate for illiterate mothers, I gave the pictures of vaccinations and I told the time and I told them to how to prevent these vaccinations from diseases to their children.
So pick right, ma'am, for the illiterate persons.
Sorry. जी मैम.
Oh, ठीक है.
Okay, if I think the question answer session has been ended from the judges, so we will ask the another participant to present their paper. I would like to ask Dr. Farzana Begum ma'am to present her paper, ma'am.
Yeah. Hello, good afternoon, respected delegates and the judges. Let me share my screen. I think my screen is visible to all of you.
Yes, ma'am, it is visible.
Okay, can start now. I want to minimize actually this thing, just want to see my screen.
And we can make slideshow.
Yeah, that's what I'm trying to do there.
Below right, ma'am.
Actually, it's not means in my laptop. It's just showing a portion. It's not full screen. I want to see. Manisha, I'm sharing my PPT to you.
Yes, ma'am. Okay, ma'am. You just share me. I'll do it, ma'am. One second, ma'am. I will do it. Just give a while, ma'am. I will do it.
Yes, yes.
I will share it now. No, it's fine, ma'am.
You can do it in open OneDrive. You can make that. Okay. Now you can do slideshow.
On this actually meeting, other things are visible, so that's why my screen is visible very small, so it's difficult to read. So,
Ma'am, I have read it on my screen, ma'am.
I want to minimize this meeting site, participate, and other things.
You can on the near, ma'am, on the right hand side, are you able to see the close option? Just see, there is a cross mark on your right hand side.
No. Can I reshare again? I think maybe that will work. I just want to see my screen in full screen. So that's what I'm trying. Can you guide me for that? Full screen. Okay, I can continue like this. I don't know the slides, so where to do that?
No, ma'am, I'm sharing you the slides, ma'am. You don't worry.
Okay. Okay, I'll start now because I don't know, something is there. I just wanted to minimize this participant and other things are visible. That side I wanted to hide so that I could see my screen totally. Anyway, it's visible. I can use now. Okay, let me start. So, a very good afternoon, all the respected delegates and guests. Here, I'll be presenting the study findings about the awareness of Saudi nurses. Those are working in mental health hospital, psychiatric hospital. So, I tried to assess the awareness among them regarding the human rights for the patients, those are or the victims, those are suffering from mental illness. So we often think if the country, any country, they enact some mental health legislation, then the human rights are protected. But are the human rights of individuals with mental illness fully protected in daily psychiatric care? And does legal reform automatically translate into clinical practice? These are my research questions. Actually, I was there with my student for clinical supervision, and I found a different type of setup in locked wards like that. So this actually encouraged me to conduct the study. So here I'm sharing my findings. So globally, individuals with mental illness, they continue to experience this coercion, stigma, limited participation in care decision, and these issues impact their treatment outcome. And of course, it also affecting the trust in healthcare system and the overall dignity. The United Nations Convention on the Rights of Persons with Disability that reframed mental health as a right issue. And the World Health Organization Quality Right also initiative promote the autonomy, recovery, and least restrictive care. These frameworks establish actually the global expectation for ethical mental health care. Saudi Arabia, it implemented the mental health law in 2014 under the Saudi Ministry of Health. This actually I'm discussing here because I was there in Saudi Arabia just since last 4 months. I left Saudi Arabia. I was there, so I have conducted the study there. This law safeguards informed consent, confidentiality, and structured admission procedure. However, legislation alone does not ensure compliance. So while the study means there are very few studies exist that actually assess this knowledge, attitude, and practice simultaneously within the Saudi legislation framework. This gap actually limits the understanding of implementation of effectiveness. The aim of the study was to assess the knowledge, attitude, and practice, and examining the correlation between these variables. The research design I've applied here is a quantitative, descriptive, correlational, cross-sectional design, because in a single point of time we've collected the data. Setting the study included 109 psychiatric nurses from inpatient unit of a selected hospital in Saudi Arabia. Convenient sampling was applied. Inclusion criteria, those are Saudi natives, nurses, those are Saudi natives and working in inpatient ward and involved in direct clinical care and voluntary participation. Data collection tool I have used structured self-administered questionnaire for demographics data, knowledge scale, attitude scale, 5-point Likert scale used, and practice scale. These items were developed based on Saudi national law and international human rights standards. The tool underwent expert review and demonstrated acceptable internal consistency. And so overall internal consistency reliability is 0.84. Data are collected electronically by sharing the link, Google Form link. Data analysis done with SPSS and the Pearson's correlation set at P less than 0.05. So the results are majority of participants were male, only 9 were female, otherwise all are male, and all are between the age group 25 to 35 and have completed bachelor degree. Important thing that draws the attention is that they all just completed this basic BSc nursing courses, but no formal training on mental health law they have received. Knowledge levels were very encouraging. 64% they demonstrated good knowledge, 33% moderate, but 0% poor knowledge. This shows there is a strong foundation of awareness. Attitude level, there is, despite adequate knowledge, 70% they showed a neutral attitude. So, which means 70% neutral, and this is something, it's a hidden risk. Even if they have very good knowledge, but their attitude is neutral. And neutral, it's not right-based care that may indicate hesitation in advocacy or something. Next slide. Practice square were moderate, 33% only they showed poor practice. Majority they showed moderate, but no high-level practice. And this reflects there is a knowledge practice gap, because knowledge shows means very high-level knowledge. Next, please. And in the correlation, we found there is a very strong positive correlation between knowledge, attitude, knowledge practice, and attitude practice. This suggests the education is strongly influenced the implementation. So we found good knowledge, neutral attitude, moderate practice. And however, this attitude, neutrality, and moderate practice that indicate maybe a systemic barrier, because all the staffs, they didn't receive any formal training on mental health. So that may be a reason. There are system level concern, no formal legislative training they have received. Early career workforce, because all are between this age group, 25 to 35 age group, and institutional cultural influences practice, these are there. Then high need of supervision and mentorship is required. Multi-level interventions are needed, mandatory mental health law training, right-based institutional protocols, anti-stigma intervention, and continuous professional development, monitoring compliance mechanism. These things are needed to implement. Limitations in the study, or there's a single site study only a particular one selected hospital taken. Then it's convenience sampling and self-reported data. And again, it's means cross-sectional design. So these things are anyhow limiting the generalizability. So here I'd like to conclude, mental health legislation is a powerful declaration of dignity, equality, yet the true test of any law that lies not in policy document, but at the patient's bedside. And the finding of this study, this shows that knowledge is of course necessary, but not sufficient, and education must be strengthened. Institutional culture must evolve, and system must actively support ethical practice. Protecting human right in mental health, it's not just a legal obligation, it's a moral responsibility. When psychiatric nurses are empowered with knowledge, training, and structural support of human right, then this human right, it can move from paper to practice. The future of mental health care depends not only on reforming law, but transforming in practice. So this is all about the study. Here, actually, I underwent, regarding the ethical, I underwent online training. They have a course for ethical clearance. So I underwent that, and automatically online certificate will be generated. That also I received. But after that, I had to apply for the ethical clearance with that certificate and the tool. The norm is like that. They will assess the tool again, and they will share the tool with the staffs of the hospital. But in the meanwhile, because I left Saudi Arabia, I shared the link with some of the known, because I used to go, so I shared that link with some of the staffs, and I received few of the only responses. And I was unable to get the ethical clearance from the hospital. And how much I have received the data from that, just I analyzed and found this result.
So, ma'am, you have not, this study have not ethically clearance.
No, I have not received that ethical clearance. Just it was under process, and in the meanwhile, I left.
Okay, can you put first slide statement?
From here. Manisha, madam, you are controlling the slide, I think.
Madam, I would like to know why you have selected the Saudi Arabia hospital, because you are working over there, ma'am.
I was there for 6 years, and I used to go with the students for clinical supervision. So I found means they are keeping the patients under lock and key. It's like a general ward, but uh, all the patients they are under lock and key. So I found these are quite strange. And in that time only, one of my students used to conduct a study in India on the same one, and she sent me the tool for validation. So I have just modified little bit in that tool, and I conducted this study.
Okay, that means you were knowing that language, ma'am, Arabic language you should know, right, ma'am?
No, the staffs, this is conducted on the nurses, and nurses, they know English.
Okay, so they were knowing like Hindi, English and all, right? No, ma'am?
No, Hindi, English also very poor, but yes, nurses.
Because actually I was also there in abroad for a few years. So when I was there in Kuwait, I hope you know that it is also a Muslim the country, and they were not aware of English also. When I'm talking to them also, they were not that much. So that's what I was asking you, ma'am.
Yeah, but these days it's IELTS course is mandatory for all the Saudi nurses. So they are completing IELTS, and Chinese language they have in their elective module.
Elective module, yes,
Language and IELTS. So most of the students, they are nursing students, they are doing IELTS, and the staffs they know English. General people they don't know. Yes.
Okay.
Ma'am, human rights awareness among the psychiatric nurse, it is which have taken from the other country. So any differences? Means, of course, the human right, maybe any differences in India or in Saudi, or maybe in whatever country Kuwait you're staying?
Yeah, I found means the basic knowledge as per the tool, it's showing they have good basic knowledge. But again, because they are keeping the patients under lock and key, means somehow, somewhere, they are not practicing the rights. So I felt that means there somewhere the human right is not protected. Keeping under lock and key, it's not fair. It's not coming under human rights.
Ma'am, is it the hospital protocol?
Yes, they have this type of hospital protocol. I
So
raised
how-
this question also there. I asked them why you are keeping like this, because it's not looking good.
Yes. But then how much control the nurses would have, even if they have got the knowledge, they have, like as you have studied about the knowledge and attitude of both the things. So how much effect would it really have on the type of care they are providing to the psychiatric patients?
They are providing care just like in a general hospital. They are doing the nursing care in the same way. So there is no patients' relatives, no one were allowed. Means they are taking care, means taking care of the food and personal hygiene, everything was good. But only thing is that patients are under lock and key. And this is something not looking good, because previously I have worked in Ranchi, and I have visited that Ranchi Central Institute of Psychiatric so many times. I have the good connection there. So it's a completely different scenario. So these things are lots of changes are there. I have seen there. In Saudi Arabia, it's like a general hospital. Each ward, it's under lock and key. Someone is sitting there at the door, and if you knock, they will just open and ask whoever, and they're allowing the selective people only inside the ward.
Okay. Thank you.
Is it done in a private hospital or government
No,
hospital?
it's a government hospital actually.
Might be nurses have to adhere to the protocol of hospital, because even though have as Gargi ma'am told, even though they have the knowledge and the practice, still we study in our curriculum, but might be they are adhere to the protocols.
Yes, maybe.
Ma'am, are you compared it with what is the knowledge and the awareness in the Indian nurses
No, I have not compared it anything.
Okay, okay. Okay, ma'am. Thank you. Ma'am, I would like to ask, ma'am, this culture regarding the cultural beliefs about a mental illness, ma'am, in Saudi,
Yes.
whether it was influencing the patient rights, ma'am, because you said
Yes.
so specific. Yeah, ma'am. May I know regarding that, ma'am?
Yes, they have Saudi mental health law. This is enacted in 2014, and it is also influenced by that Sharia law. So, as per that, means the patient can be admitted, means with the consent of guardian, family member, guardian, like that. Some of the things are influenced by that. Means when I underwent that online course to get the certificate, it was mandatory for that. So that time I found these things. It's also influenced by this Sharia law. So some changes are there.
Okay, ma'am. Thank you, ma'am. All the best, ma'am. Thank you, ma'am.
Welcome.
Okay, so we will continue with the next presenter. And the next presenter is Supriya Sharma, ma'am. So, ma'am, are you ready with your presentation? Supriya Sharma, ma'am?
Yes, ma'am. Yes, ma'am. I'm ready.
So you can continue with it, ma'am.
Ma'am, shall I upload my PPT? Or you will?
Yes, ma'am, you can.
Okay.
Ma'am, are you ready with the PPT or like shall I ask the other presenter, ma'am?
Ma'am, I'm presenting, ma'am. Is it visible?
No, ma'am, it's not visible. Yeah, now it's visible, ma'am.
Okay, ma'am. Thank you.
visible, ma'am.
Shall I start, ma'am?
Yes.
Okay. Good afternoon, respected judges and fellow participants. It is a privilege to join you today, and I sincerely thankful for giving me this opportunity to present my work. So this presentation will focus on ODD, that is oppositional defiant disorder, a childhood behavioral disorder, and will be discussing its prevalence, manifestation, and associated findings. The background of the study is oppositional defiant disorder is a childhood behavioral disorder that is a persistent pattern of defiance, irritability, defiant behavior toward authority figures, and many manifestations of this oppositional defiant disorders are argumentative behavior, where children frequently challenges rules or temper outburst marked by anger and frustration, deliberated attempts to annoy others, provoke others, often in social or family settings, refusal to comply with rules and requests, that is, which can significantly impact functioning at home, school, and in peer relationships. So, impact of ODD, that is in impaired social, academic, and family functioning. It often leads to distress for both the children and their primary caregivers. It often seen with other psychiatric conditions, and in most of the cases, it persists in adolescence and adulthood with worsening symptoms, which leads to conduct disorders. Adulthood. Okay, so need of the study is, this need for the study arises from the high prevalence of ODD among children and adolescents. Its frequent co-occurrence with other psychiatric disorders highlights the importance of adopting a multidimensional approaches to assessment and interventions. So its high prevalence and frequency so the studies indicates high comorbidities rates between ODD and disorders such as ADHD, anxiety, mood disorders, and conduct disorders. So the research question is, what is the prevalence of oppositional defiant disorder and its association with comorbidities? Evidence from child and adolescent population. Objectives are to estimate the pooled prevalence of oppositional defiant disorder to analyze, and the second one is to analyze the association between oppositional defiant disorder and common psychiatric comorbidities, that is ADHD, conduct disorder, anxiety disorders, mood disorders, and autism. Inclusion criteria, the studies, the publication focusing on early generation alpha population was taken. Studies reporting prevalence of ODD with comorbidities were also included in the study, and the study assessing ODD in population above 18 years of age were excluded from the study. With the help of Prisma checklist, after the identification and screening, I have taken 13 studies for this review. I have used Abisco, ProQuest, and PubMed for analyzing the studies. Methodology: the studies published from year 2004 to 2024, and total 13 studies were taken. Total study participants were 14,201, and search strategies, I have used the database, that is PubMed, Abisco, and ProQuest. Study selection criteria, prevalence, and comorbidities with ODD. So these were the studies I have taken for the prevalence, for measuring the prevalence of ODD with other comorbidities. Discussion. So objective, to estimate the pooled prevalence of oppositional defiant disorder. The pooled prevalence of ODD across studies ranged from 9.5% to 11%, with variation attributes to geographical location, diagnostic criteria, and sample demographics. Gender differences were inconsistently reported, through some studies noted a higher prevalence in male population. From these 13 studies, the one study from India, that is Mr. Mishra in 2014, have also checked the prevalence of ODD, and that was 8.5%. To analyze the association between ODD and common psychiatric comorbidities, that is ODD demonstrated high comorbidity with several psychiatric conditions like ADHD 26.1% to 53%, DMDD 92%, post-stress syndrome 22%, conduct disorder 5%, anxiety 41.96%, depression 21.43%. The comorbidities of ODD with other psychiatric disorders like conduct disorders, Nagata in 2023 reported a 5% higher prevalence of ODD in children with conduct disorder. Disruptive mood dysregulation disorder Maya's 2016 found that 92% of children with disruptive mood dysregulation disorder had ODD, while Freeman in 2016 reported an odd ratio of 53.84 for youth with disruptive mood dysregulation syndrome also have ODD. Post-traumatic stress syndrome, Hoshare, in 2024 found a 22.9% prevalence of PTSD comorbidity with ODD, and anxiety and depression in 2019 was reported that 41.96% of children with ODD also had anxiety, and 21.43% had depression also. I'm completing my study. So ODD is a prevalent childhood disorder affecting a significant proportion of school-age children. The findings highlight the need for early intervention, identification, intervention, and preventive measures in school and community settings. And future studies should explore risk factors, cultural influences, and intervention strategies to manage ODD effectively. The recommendations are routine screening for ODD in schools and pediatric clinics, particularly for children exhibiting persistent defiant behaviors. And given the high comorbidity rate, intervention should be multidimensional, that is psychosocial intervention such as parent training program, cognitive behavioral therapy, and social skills training to address both ODD and co-occurring disorders, and individualized treatment plans that consider the presence of ADHD, anxiety, or conduct disorder, which is commonly co-occur with oppositional defiant disorder. Thank you, ma'am.
Good afternoon, ma'am. Supriya, ma'am.
Yes, ma'am.
It's a nice study what you have undertaken, that is oppositional defiant disorder.
Yes, ma'am.
Okay. Which setting you have done the study, ma'am? How many sample size?
Ma'am, I have done the systematic review.
Systematic review.
Yes, ma'am.
Okay. Finally, what is the conclusion you have derived?
Ma'am, in India, there are very less explored with this ODD, and I have only analyzed only 3 or 4 studies from India only, and the rest of the studies were taken from internationally. So actually, I am pursuing PhD nursing. So I am planning to conduct my study on this topic only, the impact of oppositional defiant disorder.
Among what? Which population, ma'am?
Yes, ma'am. Ma'am,
Which
school
population?
children, school children
School
population.
children.
Yes, ma'am.
Okay. Okay, ma'am.
Yes.
Thank you.
Good afternoon, Supriya ma'am.
Good afternoon, ma'am.
Ma'am, it was very interesting study, ma'am. As you say that you are a PhD scholar and you are planning to do the study in the future. Ma'am,
Yes,
my suggestion is we are focusing on the school children right now, ma'am.
Yes, ma'am.
Ma'am, may I know the age criteria, ma'am? Suppose if you're planning for the studies, because in the mental health setups, no, ma'am, you see until this, the children who are attending their adolescence period, no, ma'am, until that we can see this common symptoms, that's ODD, which we can see in that clients, no, ma'am. So that's the thing. Any recommendations regarding that, ma'am?
Ma'am, I have so many studies are based on only these school age children, that is from 6 to 12 years only. That's why I have taken this age group, ma'am.
Okay, ma'am. Thank you, ma'am.
Thank you, ma'am.
Did you find, hello Supriya ma'am, did
Yes,
you
ma'am.
find any difficulties in accessing the databases for doing the review?
Ma'am, actually in our college we have Abisco, so I have used that, and freely available PubMed database I have used, and ProQuest also. So there were little bit difficulties were there assessing the studies from India, but I have used institutional, we have in our institutional prescription of Abisco. So it was not that challenging, ma'am.
Okay. All the best for your final study.
Thank you, ma'am. Thank you so much, ma'am.
Okay, so we will ask another presenter to present their PPT. So next presenter is, her name is Nirlipta Priyadarshini ma'am. So are you ready with the PPT, ma'am? Nirlipta ma'am, are you there?
Yes, ma'am. Good afternoon, ma'am.
Good afternoon, ma'am. Ma'am, kindly just switch on the camera, please, ma'am, that we can easily find it out.
Ma'am, is it feasible?
Yes, ma'am.
Thank you. Good afternoon, all. Today I present my synopsis, that is effectiveness of stimulation-based learning and clinical decision making and quality healthcare outcomes among the undergraduate nursing student, and it is a quasi-experimental study that is happening in Bhubaneswar.
Ma'am, it's not, your file is not visible, ma'am, your PPT.
Okay, ma'am.
Yes, ma'am.
Ma'am, is it visible?
Yes, yes, ma'am.
Okay. Ma'am, my topic is effectiveness of stimulation-based learning on clinical decision making and quality healthcare outcomes among the undergraduate nursing student, and it is a quasi-experimental study in Bhubaneswar. Ma'am, introduction, that is the stimulation-based training that allow the learner to develop and refine the both technical and non-technical skill in a safe and controlled environment. Nowadays, despite of theoretical knowledge, the student also lack of confidence in real clinical situation. So the stimulation-based learning, that is the big part in health professional, that is pre-license and under ongoing education, because it allows for the reconstruction of the patient that encounters in interactive manners. So the simulation is commonly used to teach the learner for clinical practice without the sacrificing the patient safety. Then need of the study, the simulation-based learning that allows the nursing student to engage in a realistic clinical scenario where they can assess the patients, that interpret the data, make the decisions and evaluate the outcomes in a controlled and risk-free environment. And also simulation that support the experimental learning that promote the reflection through the structures defining and strengthening the cognitive and psychomotor and also that effective skill. There is a significant lack of empirical studies that evaluating the direct relationship between the stimulation-based learning and clinical decision making and quality healthcare outcomes that among the nursing student without the strong scientific evidence, and the nursing administrator and the policy maker that may be reluctant to invest the stimulation, that resources and the training program. Objective of my studies, that is to assess the baseline level of clinical decision making skill among the nursing students before exposure to the simulation based learning. Then second objective, to implement a structured simulation based learning program for nursing students. Third, that is to assess the post intervention level of clinical decision making skill among the nursing student after the simulation based learning. And then fourth, to compare the pre-test and the post-test score of the clinical decision-making skill among the nursing student. And last one, to determine the association between the post-test clinical decision-making score with the selected demographic variables. Next, a hypothesis. Hypothesis first hypothesis that is there is a significant improvement in the mean clinical decision making score of nursing student after the simulation based learning. Then there is a significant improvement in the quality healthcare outcomes score of the nursing student after the stimulation based learning. Then third hypothesis that is there is a significant association between the post-test clinical decision-making score and also selected demographic variables of the nursing student. And last one, there is a significant relationship between the clinical decision-making skill and the quality healthcare outcomes among the nursing students. This is the conceptual framework. In conceptual framework, first the structure, that is the stimulation laboratory and trained faculties and also equipment and management and curriculum support. And it is a first structure. Then under process, that is clinical scenario based, then role play, skill lab practice, pre-briefing and briefing, and also feedback from the students. The last outcome, that is improve the patient safety, reduce the error, then timely nursing care, then improve clinical competency and patient satisfaction. This is the conceptual framework of my study. Then review of literature. In 2025, according to Salimari, have undergone a significant change from its original of the traditional role playing to a highly advanced and technologically supported that modalities show the incorporation of the virtual reality and also augmented the reality and the artificial intelligence technology. The use of these various technologies that allow the learner to participate in a high-friendly stimulation and also develop the clinical decision-making skill. Due to it developed the clinical decision-making skill so that reduce the medical errors and also increase the patient safety. Then according to Abdullah and Idris, that is 2023, the research support the idea that the stimulation-based teaching learning improves many aspects of nursing education, that including the developing nursing student, also the clinical skill, then reasoning and decision making skill, while processing the ability to positively impact the outcomes of the patient. This is the review of literature. Then research methodology. A quantitative research approach will be adopted for this study as it aims to measure the effectiveness of stimulation, that based learning on clinical decision making and quality healthcare outcomes among the nursing student. And my research design, that is the quasi-experimental design, then pre-test and post-test control group design will be adopted. Then variables, independent variables and dependent variables, and also the extraneous variable. Independent variable, that is the simulation-based learning. Dependent variable, clinical decision-making ability and quality healthcare outcomes. And extraneous variable, that is age, then learning style, then motivation, faculty support, academic performance, then previous clinical exposure. Then study setting. The study will be conducted in 2 different selected nursing colleges that have fully equipped the simulation laboratories and also clinical scale laboratories. And my study population, all undergraduate nursing students of BSc nursing, they're studying in selected nursing colleges. Then my sample size, that is 60, 30 in experimental group and 30 in control group in the different 2 nursing colleges. Then sampling technique, that is the purposive nursing probability sampling technique. And these are the inclusion criteria from that the studies focusing on the simulation based learning in nursing education, then that involving the undergraduate nursing student and also reporting the outcomes related to the clinical decision making and also critical thinking and competence or confidence. And the student exposed to the clinical posting and students available during the data collection, that is the inclusion criteria of my study. Then exclusion criteria, it conducted on non-nursing population and students who previously underwent the formal simulation training and students absent during the pre-test and the post-test. Then demographic variable, age, gender, year of the study, then clinical exposure and academic performance. And my data collection method, that is the permission from the institution first, then pre-test for the both group, that is the 2 different nursing colleges, then implementation of the simulation program in the experimental group and traditional teaching for the control group. Then post-test after my pre-test of the 1 week, then data completion. And my tool is first the demographic questionnaire, that is the demographic variable, age, gender, and year of the study, then clinical exposure and academic performance. Then second, then clinical decision making in nursing scale, that is the 4 items available. The 4 standardized, it is a standardized scale that is developed by Jenkins in 1985. And under this scale, that is 40 items is available, and scoring, that is a Likert scale, 1 or never, then 5 always, then higher score that indicate the better clinical decision making. Then a third tool, that is the credit card competency evaluation instrument, and also the tool assess the observable clinical behavior under the 5 major domains. These are the 5 major domains. First one is assessment, then communication, then clinical judgment, then patient safety, and that is professional behavior. These are the 5 major components. In this component, the rating scale, first that is non-demonstrated, then rating 2, that is need improvement, any improvement need, that is 2, then 3, that is complement, then 4, highly competent. Validation and reliability, validity and reliability, that is content validity, tool will be validated by the subject expert, then reliability, that is the conversed alpha. Then the statistical analysis, descriptive statistical, then mean and standard deviation, then incremental statistics, paired t-test, then independent t-test, then chi-square. Then my expected outcomes of the study, that enhance the clinical decision making, that the nursing student exposed to the simulation-based learning are expected to show a statistical significance, that improvement in the clinical decision making. Then improve the quality healthcare outcomes. In this, the student participating in the simulation-based learning are expected to demonstrate the significantly better clinical performance and safe for the patient care, as it measured by the higher source of the evaluation instrument. The positive relationship between the decision making and the performance, that is the significant positive correlation, is expected between the clinical decision making score and also quality healthcare outcomes. And it also indicating the improved reasoning leads to improve the clinical practice. Last outcome, that is the effectiveness of stimulation, that is simulation-based learning. As a teaching strategy, the simulation-based learning is expected to be proven as the more effective instrumental method than the traditional teaching, and also it providing the evidence for its inclusion in nursing education programs. Last is conclusion, my topic. Conclusion, the study is expected to provide the strong empirical evidence that simulation-based learning that enhance the post-clinical decision-making and also quality healthcare outcomes among the nursing students by improving the cognitive reasoning and observable clinical performance. That simultaneously, this simulation-based learning can bridge the gap between the theory and practice. The finding will support the integration of structured simulation program into the nursing curriculum, and ultimately that contributing to the safer and more competent and confident, that is the nursing professional. Then, thank you. Ma'am, I concluded. Okay.
Gargi ma'am, Saraswati Purohit ma'am.
Hello. Ma'am, like you have used 2 scales in your study. One
Yes,
is
ma'am.
credit and competency evaluation instrument, and second is the clinical decision making nursing scale, I think, right? Am I
Yes,
right?
ma'am.
Yeah. Where there's are these standardized tools, and have you taken permission? And what about the ethical consideration before doing the study?
Ma'am, it is a standardized scale, and also it is previously in a literature review, I had seen there is 2 research already done.
Okay, so these are open tools, is it?
Yes, ma'am.
Okay. Okay, what about like, can you in crisp tell us about how you have implemented and checked about the clinical decision making among the sample?
Ma'am, first in experimental or control group, though there are two groups. In experimental group, we implement the simulation program. After then in traditional teaching, that is in control group. The questionnaire will be same, but it differ in two different nursing colleges. So there is no bias, and also yes, ma'am.
Was it for any specific procedure or any, what exactly have you checked in clinical decision making?
I mean, clinical decision making, there are 40 items. In 40 items, already the standardized scale is prepared. So on the basis of the scale, we measure the student the decision making skill by
Yeah.
helping the Likert scale.
Okay, but the simulators which you used were low fidelity, high fidelity, or how it was, like how you have done it?
Ma'am, I only uses two scale. So on the basis of the scale, we analyze the pre-test and post-test. So then after post-test, then correlate under pre-test and post-test among the demographic variable.
Who has implemented the simulation?
Yes, ma'am.
Who has implemented the simulation method?
Ma'am, me also.
Okay.
Ma'am, I am presenting my simulation process to the students.
Yes. Okay. Okay, ma'am. Thank you.
Good afternoon, ma'am.
Good
So whether
afternoon.
the intervention was given for control group also after the study?
Yes, ma'am.
Whether your intervention like simulation based learning, whether it has been administered for control group also?
No, ma'am. It is only experimental group. Then after pre-test, then traditional teaching only I will provide in control group.
No, ma'am.
Simulation
To avoid the bias, after the post test, we need to give for the control group what the intervention will be planned by the researcher. So after the post test.
Okay. Ma'am, also after the post test, I also provided simulation program.
For control group?
Yes, ma'am, control group.
Okay, then it's fine. So, like, have you planned the case scenarios to provide the simulation?
Yes, ma'am. Simulation, ma'am. I just planning in hurry, so I just prepare my synopsis to present.
Okay.
If it will pass, then I will.
Yes, ma'am. Validated case scenarios, it will be better for the simulation. It's good study, ma'am. Thank you.
Okay, thank you, ma'am.
So we will move forward with the next presenter, and her name is Jovita. Jovita, ma'am, are you available?
Yes,
So
ma'am.
So you can, yeah, ma'am, you can continue with your session, ma'am.
Yes. Thank you, ma'am.
You're most welcome.
Ma'am, it's visible?
Yes, ma'am.
Okay. Good afternoon, respected judges and my dear colleagues. I'm here to present a poster presentation on nurses as One Health addressing antimicrobial resistance and attitude assessment in an Indian tertiary care hospital. If we come towards the introduction part, as we all know, antimicrobial resistance is a major global health driven threat that is largely driven because of the inappropriate antibiotics used in care settings. The One Health approach highlights the link between the human, animal, and the environmental factors in the spread of the resistance. As we know, nurses are the frontline caregivers playing a very vital role in the antibiotic stewardship, infection prevention, and patient education. However, there is a variation in nurses' knowledge and attitude that may affect the safe antibiotic practices. Hence, this study assessed the nurses' knowledge and attitude towards antibiotic use and resistance in a tertiary care hospital to strengthen the stewardship efforts. Towards the aim of the study aimed to assess nurses' knowledge and attitude towards antibiotic use while conducting an educational workshop on antibiotic stewardship and their role in it. The role was for the nurses. This initiative will enhance the nurses' contribution to preventing antibiotic resistance as well as improving patient care. Coming towards the objective of the study, to evaluate the nurses' knowledge and attitude towards antibiotic use and the prevention of antibiotic resistance. Coming towards the hypothesis of the study, between the nurse's knowledge and attitude regarding antibiotic use and the antibiotic resistance. With this, we had to the methodology. In the methodology part, the study was a quantitative descriptive survey where we had 300 registered nurses taken into as our samples using a proportionate stratified sampling, where we saw that the nurses were coming from the wards as well as ICUs of AIMS Raipur, and the data collection was done using demographic questionnaire, and 22 items questionnaire was there, and 24 items Likert attitude scale was there. The reliability for knowledge was found to be using split half method, 3.8, and attitude it was 0. The data analysis was done using the descriptive statistics, Carl Pearson's correlation test. Coming towards the result, in the socio-demographic variables, we can say we found the mean age was like the majority of the nurses that we have taken. They were 63.3% in the 21 to 30 years of age group. So we can say the nurses were young. And in terms of, we can say gender, 55% female and 45 were male. And in terms of qualification, 84.7% has BSc nursing degree and 7.3 had only MSc nursing degree. And in terms of area of working, so we had almost 69% of nurses were working in the wards and 31% were working in the ICUs. In terms of experience wise, we had 74% who were having 0 to 5 years of total years of experience. Coming towards the main highlight of the study. So just a second. In terms of knowledge, we found 91% had adequate level of knowledge and 9% had moderate level of level of knowledge. In terms of attitude, we had 97% had favorable attitude and 4.3 had moderately favorable attitude, and none of them were having unfavorable attitude. When analysis, so using the correlation analysis, 2.27 level at the p-value of 0, having a positive statistic significant relationship. That means as the knowledge was, so was the attitude. Okay, but significant association. So with the knowledge we found, nurse was use. So that was increasing their knowledge of use, and in the infection control programs were having a favorable knowledge, or they had a significant association with the knowledge as well as attitude. As we can see in the graph also, where we have shown the level of knowledge of the nurses regarding the antibiotic use. So we can see like one towards conclusion. We can say the study concluded that 81% of nurses knowledge, percent had favorable attitude with a positive correlation between the knowledge and attitude at 0.267% with the p-value of 0.01%. With this, we can say the recommendations given in the study were that the nurses should be also included in the multi training programs that we have. They should be specialized according to the ICUs or the, so that their experience can also be reflected in their practices. Health stewards. So we will the gap between the policy and the bedside practice gap. And with this, I will share that I have a QR code shared for a very detailed bibliography as well as the statistical data findings.
Good afternoon, Jovita madam.
Good afternoon, ma'am.
Like, what insisted you to take this study, ma'am?
Ma'am, actually speaking, in our hospital, we have seen a lot of infection control being done. But we have seen that the nurses, they are giving patient education also to our patients. But what happened was, a lot of times when the patients, they are being taught about, like, for kind of antibiotics use that is there. So why it is necessary to have the designated, duration of the antibiotics to be there. So that sometimes the people here don't understand. Sometimes, and like we shouldn't be sharing our antibiotics. Like, for example, I had cough and fever. So my same antibiotic can give it to somebody else in the family if they are having. So this kind of a practice was this was something we have. That is how we thought that the nurses can be helping in patient and the importance of the antimicrobial resistance.
Okay, have you assessed the pre-knowledge and the pre-attitude?
No, ma'am. Actually speaking, we can say from this study, one of the major backdrop that we found was, since it is a self-reported, questionnaire, the questionnaire that we gave or the attitude state that we gave, that was self-reported. So there can be a bias in there. Because it was
ma'am, like without knowing their knowledge and attitude. So,
Yes,
like before conducting a study, we should know their knowledge and attitude. Then only we can implement and we can correlate their attitude and knowledge. No, the pre-knowledge should be assessed. Have you done that, ma'am? Can you hear me, ma'am? Pre-knowledge, are you assessed among your samples, ma'am?
No, no.
Because without knowing their previous knowledge or prior to the implementation of the intervention, so how come we can correlate our knowledge and attitude? So you know that what is their attitude before administration of the test?
Ma'am, it was not an intervention study.
Okay, it's a descriptive, only survey method you have done. Survey method you have done, ma'am?
Yes.
Okay, okay. Then,
with this level of knowledge, now we are giving recommendations, ma'am.
Okay, okay. Okay, ma'am.
Is there any specific ward or unit you have selected for the survey?
Yes, ma'am.
Is there any specific unit, ward you have selected for the survey?
Ma'am, I didn't get the question. Your voice is a little.
Is there any ward or selected units, like you have only selected critical nurses or those
No,
who are
ma'am.
working in ICU?
No, ma'am. We have selected from all the wards and all the ICUs, the whole hospital, ma'am.
And how we have bifurcate the antibiotics? It is according to any kind of pharmacokinetics?
We have seen the level of knowledge that we saw in the nurse. They were having like what they have using, like the previous 1 year they're working. They had more level of knowledge in that only. That is, it was reflected.
Only in antibiotic. It is not, and you have not bifurcated for any classification according to any
No, ma'am.
kind.
No, ma'am.
Only just an antibiotic, and you have to check their knowledge.
Yes, ma'am.
Okay. How much time you have taken for this? Only it is a
Ma'am,
survey
we
method.
took 2 weeks, ma'am.
2 weeks.
Yes, ma'am.
Okay. So any correlation related the duties like night duties, nurses who have done more night duties, or maybe those nurses those who have done more morning duties, or any kind of shift
No, ma'am. No,
changes?
ma'am. Ma'am, in our inclusion criteria, we had the nurses firstly who were like willing to participate in the study, and the ones who have had 6 months of in our own hospital. Have a total experience of maybe n number of years, but in our hospital we have 6 months, ma'am. Because in our hospital, like you can say, within first 6 months, they are hardly given too much of nights or other like complicated kind of a cases are never given to them to handle.
Okay, fine. Thank you.
Thank you, ma'am.
Hello.
Yes,
Ma'am,
ma'am.
is there any difference in the knowledge and attitude you found according to the experience of the nurses?
Ma'am, I get your question.
Hello, can you hear me?
Yes, ma'am. Yes, ma'am.
Yeah. Did you find any difference in the, according to their experience or according to the area of work, wherever they are posted? Was there any difference in their knowledge and attitude?
Yes, ma'am. We found like the nurses who are working ICUs, their level of knowledge was slightly higher than what we saw in the wards. And, like we can say, in the ICUs, we have more number of antibiotic being used, but wards. So those nurses were having higher level of not only knowledge but even favorable attitude.
Okay.
So if the Q&A session has ended, then we will ask the another participant to just present the paper. So Shamsheer Begum, ma'am, are you ready?
Thank you.
Yes,
You're most
madam. Yes,
welcome,
madam.
Okay, ma'am. So you can continue with your presentation.
Yes, madam.
Manisha ma'am, how many you have left?
Ma'am, only after Shamsheer, madam, 2 members are there, ma'am.
Okay, fine. And it is a
Yes.
poster or okay.
Yes, yes, sir. Yes. Excuse me, madam.
Yes, sure, ma'am.
Otherwise, madam can share. Yes, yes. Madam, good afternoon. Madam, yes, madam.
Manisha
May I
madam,
start, madam? May I start, madam?
Manisha madam, I have one request. There is a small pop-up box which is coming, the similar
Yes,
screen.
ma'am.
If you are
Yes.
minimize it or close it, it will be visible the full screen to us.
Yes, ma'am. Shamsheer, ma'am, you just minimize that thing.
Yes,
The
yes.
side pop-up box, ma'am.
Nice.
Or shall I share, Shamsheer, ma'am?
Yes, madam. Yes, madam, please.
I'll do it from my end, ma'am.
Yes, madam. I will stop sharing, madam.
Yes, you just stop sharing. I'll do it.
May I start, madam?
Yes, ma'am, you can continue. I will just.
Good afternoon, all the respected judges as well as organizers and my co-presenters. My study is effectiveness of structured teaching program on knowledge regarding complementary feeding among mothers of infant. So coming to introduction, children are our future and utmost precious resources. After birth, the health of the baby depends on the nurturing practices adopted by the families. Children always meant special care to survive and thrive. Good health of those precious members of society should be ensured as prime importance of all countries. Today's children are tomorrow's citizens. Health of children make a health of nation. Hence, the importance of feeding them right from the birth, especially first year of life. The WHO recommends exclusive breastfeeding for the first 6 months of life, with the addition of complementary feeds at 6 months, with the continued breastfeeds until at least the age of 2. Infants and young children are at highest increased risk of malnutrition from 6 months of age onwards, when breast milk alone is no longer sufficient to meet all their nutritional requirements, and complementary feeding should be started. Coming to need for the study, children constitute the foundation of the nation. Healthy children evolve to become healthy adults and effectively participate in the national development. Fulfilling the nutritional requirement of the infant helps to achieve the basic goal of satisfactory and growth and prevention of acute and chronic illnesses. Complementary feeding, as described by the WHO, refers to the addition of energy and non-energy containing fluids, non-human milk, and semi-solid or solid to children diet. So complementary feeding is the time of nutritional vulnerability. It represents a period of dietary transition just when nutritional requirements for growth and brain development are high. The term complementary feeding has been traditionally described as withdrawal from not breastfeeding. It is along with breastfeeding, we are inculcating the knowledge to mothers. My objectives are to assess the pre-test knowledge regarding complementary feeding among mothers, to develop and implement structured teaching program on complementary feeding among mothers, to evaluate the effectiveness of structured teaching program on complementary feeding among mothers, to determine the association between post-test level of knowledge of mothers with selected demographic variables. Hypothesis is H1, there will be a significant difference between pre-test score and post-test score on knowledge regarding complementary feeding among postnatal mothers. In methodology, my research design is pre-experimental, one group pre-test, post-test done. Variables are, independent variables are STP on complementary feeding. Dependent variables are, so primary para mother's knowledge on complementary feeding. Setting of the study is, this is Andhra Pradesh, Vijayanagaram district, Nillimarla Mandalam and Chandranapet village, Andhra Pradesh. The sample and sample size is 50 primary para mothers. Sampling technique is non-probability convenient sampling. Criteria is inclusion criteria is primary para mothers of infant, mother's ability to understand and respond, and those who gave consent to participate. Exclusion criteria is mothers with infant having severe health issues, mothers with cognitive impairment, mothers who already participated in STP, similar STP education, and not available for the follow-up during the post-test. These are the exclusive criteria. And structured questionnaire was developed to collect the data. So analysis was done with the help of descriptive and inferential statistics. And in the pre-test, mothers, 68% of, say this is total 50 mothers, 68% of mothers. So in the pre-test had inadequate knowledge, and moderate knowledge 24 mothers, 24%, adequate knowledge only 8%. That is 4 mothers are having adequate knowledge. After post-test, 6 adequate knowledge goes to 28%, and moderate knowledge goes to 66%, and inadequate knowledge is 6% after STP. Excuse me. Research gap points are limited studies on STP effectiveness, and not focused on urban versus rural differences, and long-term knowledge retention is unclear, limited evidence on how well mothers retained knowledge on complementary feeding, that is post-STP. And comparison with other educational interventions are lacking, like video-based learning, group discussions, mobile app-based educations. Coming to implications, nursing practices, nurses can actively conduct STP on complementary feeding during postnatal checkups, immunization clinics, community outreach programs. In nursing education, students should participate in community health teaching programs related to complementary feeding. Community health nurses can reinforce teaching during home visits. And nursing administration, nurse administrator can organize regularly structured teaching sessions in all the villages, hospitals, PHC. So develop protocols and guidelines for standardized maternal education on complementary feeding. Nursing research can be done by video-based learning methods and group discussions on complementary feedings. Mobile app-based education, especially in local language, is more needed. Conclusion is, the study concluded that there is a strong need for timely introduction of complementary feeding and counseling during the pregnancy, lactation, and illness, making the mothers aware that even complementary feeding is required for the nutrition of the child, for the growth and development of a child, which is very crucial for their life. Yes, madam. Thank you, madam.
Good afternoon, ma'am.
Thank you. Good afternoon, madam.
Ma'am, you have done the study, for complementary feeding, no, ma'am?
Yes,
Structured
yes,
teaching program on
yes,
complementary feeding among mothers.
Yes, madam.
Mothers, what is the age group, ma'am? You have taken any criteria you have used for this?
Yes,
Mothers.
madam.
What is the criteria, ma'am?
Primary parents, mothers only I took, madam.
Yes,
Age, so below 35 years, I saw, madam.
Okay,
Starting from
okay.
18, madam.
Okay, you start about the complementary feeding.
Yes, madam.
Okay, ma'am.
May I tell, madam, why I have
Did you compare, ma'am, complementary feeding or anything comparison you did, or?
I didn't do, madam.
Okay, ma'am. Thank you.
Yes, madam. Thank you very much.
Ma'am, like a structured teaching plan, like had given education for them. How different it is from postnatal education? Usually, like nursing students, when there is a postnatal mothers, they'll give the health education regarding this.
Yes, madam. Health
How
education.
differently you have planned your structured teaching program?
So starting from meaning, then so availability of resources, all those things, madam. And education. So how we can reinforce the education like that, I saw.
Okay, whether follow-up is done, ma'am, after your STP program?
So after STP program for post-test, I went, madam.
No, ma'am. Follow-up, whether you have done the follow-up with the mothers? Are they following the scheduled
Students are going,
complementary feeding?
I didn't go, madam.
Okay, ma'am. It could be better if you are done,
Yes,
ma'am.
madam.
Because
Yes, madam.
if you are
Thank you.
giving education and you are leaving, so they
Yes.
it may not be effective. Okay,
Yes,
ma'am.
madam.
Thank you, ma'am. It's
Thank you very much,
good
madam.
presentation.
Thank you very much.
Madam, what about the sample size of the primary gravida mothers, ma'am?
Madam, 50 I have selected. 50.
Okay, so you were doing in the community area, right now, ma'am?
Yes, ma'am. Yes, madam.
So whether you were able to get the samples? Because
Yes,
it is a
madam.
community. Okay, so you were asking help from the ASHA workers?
Yes, madam. So the village I have selected, which is transportation as the facilities are very less, healthcare facilities are far away from that particular village, madam.
Okay.
And population is around about 1,000 to 1,100 people are there, madam.
Okay, okay, ma'am.
Yes, madam.
So what were the challenges you are facing, ma'am, during the time of your STP, ma'am?
Yes, madam. Yes, madam. So first of all, awareness is very lack, and permissions I should get from higher authorities, their local authorities, madam. So meeting them, getting permission itself somewhat difficult for me. Then I went regularly. I went, madam, and for them also we have to create some so confidence. So that area and the time is very important. They have to give time. They have to realize, and they have to think that I am going to give good education for them, for their practices, madam.
So whether they were cooperative, ma'am, like the
Yes,
primary
ma'am.
gravida
Very
mothers or the
cooperative.
community
Very
area.
cooperative.
Okay.
First of all, they said no, we are not having any time, but slowly they recognized the so importance of so education, madam.
Okay. Okay. Thank you, ma'am. It's
Thank
a
you very
very
much.
good study.
Thank you. Thank you very much.
So I think
Good
we
evening,
have
ma'am.
to ask. Yes, ma'am.
Good evening, ma'am. It was a nice presentation, ma'am, as you focused on community setup. It's very difficult, and I can understand that, ma'am, how much challenges you have made in the community by getting the permission from the higher authority as well as everything, ma'am. So very all the best, ma'am. And it was nice study, ma'am. Thank you, ma'am.
Thank you. Thank you very much, madam. Thank you, all the judges, and thank you, all the organizers, madam, for giving me the very good opportunity. Thank you very much, madam.
Yeah, most welcome, ma'am. So we will move on to the next presenter, Mr. Raja. If you're ready with your presentation, you can continue.
Good afternoon, ma'am. I am ready now.
Okay, sir. Then you can continue.
It is visible to see my PPT.
No, sir.
Sir, kindly try now to share the screen.
Yeah, bro.
Yeah, now it's visible.
Okay. So good afternoon to all delegates of this conference, respected judges and my dear colleague.
So it is pressure to do my research paper on comprehensive body mechanics on low back pain among staff nurses working in critical care unit and operation theatre. So introduction, low back pain is a common one for the absence of work and seeking medical treatment. So it can be result from injury, activity, and some medical conditions. And low back pain is a widely prevalent in all general population, and it is one of the main reasons for individuals who seeking medical care. And proper body mechanics is a word used for the ways where move as we go for our daily lives, and it includes how we hold our body when we sit, stand, and care. Objectives to assess the level of low back pain among staff nurses before and after comprehensive body mechanics among staff nurses. To assess the effectiveness of comprehensive body mechanics on low back pain among staff nurses. To find association between post-interventional level of low back pain with the selected demographic and clinical variables among staff nurses. So methodology, design, quasi-experimental design for one group pre-test and post-test design. So setting of the study, nurses in critical care unit and OT in Bhadraja Multi-Specialty Hospital, Chennai. So my total sample size was 60 nurses, 30 from CCU and 30 from OT. Tool, a numerological rating scale to measure pain of low back pain. An investor will demonstrate proper body mechanics for the nurses. So criteria for sample selection, inclusion criteria, staff nurses who have low back pain, staff nurses who were willing to participate, staff nurses who are available throughout the study, and exclusion, staff nurses who are severe pain, need surgical intervention, and staff nurses who are underwent any surgeries. So data analysis and interpretation of findings. So description of demographic variables of staff nurses with low back pain. So section B, description of clinical variables of staff nurses working in critical care unit and operation theatre in pretest. Section C, assessment of level of pain among staff nurses working in critical care unit and operation theatre. So section D, to assess the effectiveness of comprehensive body mechanics on low back pain among staff nurses working in critical care unit and operation theatre. So to find out association between post-interventional level of low back pain with the selected demographic and clinical variables among staff nurses working in critical care unit and operation theatre. So the assessment level of pain among staff nurses working in CCU and OT. So this is a pre-test level. The data presented in the table 3 shows that majority, 27 or 45% of staff nurses having moderate pain in pre-test level of pain score, and 31.67% nurses have severe pain in the pre-test level, and 23.33% of staff nurses having mild pain in the pre-test. So this is the result graph of pre-test. And the post-test level of the pain score, the data presented in the table 3 shows that the majority, or 69% of staff nurses have mild pain in post-test level of pain score, and 35% of staff nurses have moderate pain in post-test, and 0% of nurses having severe pain in the post-test. So the majority, after giving the comprehensive body mechanics to the nurses from the pre-test and post-test, so you can see the numbers, it will be reduced. So the severe pain became 0%. So conclusion. In conclusion of this study, as comprehensive body mechanics can be effective in reducing low back pain among staff nurses. This study shows how we can manage without any pharmacological and surgical interventions and knowledge of comprehensive body mechanics.
So the judges.
Good afternoon, sir. It's a good study where like a long standing will leads to the back pain for the nurses.
Yeah.
Like review of literature. So whether they have conducted many studies related to this, what review of literature shows?
Yeah, related to the studies, they have conducted a lot of review in the different areas and different locations they have conducted. So I taken this, I chose this one.
Okay. And one more question is that, you have taken the nurses, different working areas. One is in operation theater and one is ECU.
Yeah.
It will differ, no, sir? So why you have chosen two different areas?
This both are the critical one, we can say, because my personal experience, I worked in OT, so I know the staff nurses procedure. So during the transfer of the patient, the staff nurses get too much because of improper procedure. We cannot maintain a proper thing, so we need help everything. So considering that, I studied them, and in CC also same, which I have seen my experience. So the nurses also get low back pain because during the emergency time, the nurses want to give CPR or any kind of procedure.
Yeah, they'll
So
be
they
having
cannot
long
maintain.
stand.
Yeah.
Okay.
Sir, I want to ask one question. As you are also a male nurse, have you found any differences between the female cases of back pain or male nurses have a back pain differences?
Female nurses have low back, more back pain compared to male nurses.
Compared to male nurses. So,
Yeah.
it is this point. Have you studied this? Your study in your research study?
No, during my study only, I also noted this. The female nurses have more back pain because they want to work in a family also, and in the hospital
But
also.
the
Going
hours
together.
will be same. The working hours will be
Yeah,
same.
working hours is same work load also for them, same procedure, everything will be same thing. No difference in that.
So, any kind of, you can say, research evidence we have find out that male have a less back pain compared to female.
No, depends. Male have less back pain because of the physics of the male, so compared to the female. But nowadays, a lot of people is aware. They're going for the exercise regularly, so they're maintaining the body posture.
Okay.
Thank you.
Thank you.
Thank you.
Hello, sir.
Hello,
Sir,
madam.
yeah, do you find there is any gap between, like, even if they know about the body mechanics, but as you said, these both are critical care areas.
Yeah, during my research, I find out gaps because of the critical. We are as a patient care, as a nurse, we are doing the patient care. So I find out the care during any critical situation. We cannot maintain the proper body posture, or we cannot maintain the thing. So we want to save the patient life. So during shifting the patient or during any kind of procedure, we cannot able to be aware of that, but we cannot do that also. It's a very huge gap in that areas.
Right.
So, if the question and answer session has been ended, so we will try to wind up the session for today's this presentation. And so, just I would like to thanks to all the judges and all the participants, because after you can say, like, after many years, I have seen this kind of discussion in this poster, like in this presentation for the poster and the paper presentations, because even I have also presented the paper in many of the conferences, but I haven't seen this kind of question, like questioning from the judges to the participants. Like, with continuously the judges, they started putting the questions to the participants. It's really, I'm really happy for this, that hoping for the best. If next time I will participate in any of the this presentation, I will also get the same kind of judges that they can shoot the questions to us, like for me also. And I may many, or like most of the judges, they are too experienced from me. So even I have learned lots of things from you people, and from how to present the paper and the posters in the conferences. I have learned from the presenter also. So thank you for this presentation and for judging this session, ma'am. So we will wind up for the session for today and tomorrow and day after tomorrow, as the conference is there. So we'll try to meet everyone over there sharp 10 a.m. in the morning.
Thank you, ma'am.
Okay.
Thank you for all the judges.
Thank you, ma'am.
Thank
Thank
you.
you, ma'am. Thank you for the opportunity.
Thank you, Manisha ma'am, for the opportunity. Thank you so much.
Thank you for the opportunity.
Okay.